Hi, my name is Ileana, or otherwise known as Elle. Today I am presenting a medical presentation that I have done about how self-hypnosis can save somebody's life. I have had memories of having participated in a 60-and-back secret space program through a quantum leap time travel experiment where I had worked as a cybernetics technician on the Mars laboratories, where I made human cyborgs, where the cyborgs were fused with nanotechnology, advanced technology that is 200 years more advanced than what we have here on Earth. So humans were being abducted from Earth and being placed in these Cybernetics Labs on Mars. They were physically experimented on. Their genetics were modified, and biological drug serums were being used on them in conjunction with having the Neuralink implants infused into their brains. All of this is 200 years more advanced than we currently have in medical stuff on Earth, except we do have the biological drug serums, which are equivalent to the immunoglobulin therapy that is available for patients that have autoimmune disorders and other rare neurological medical conditions, which I'm one of such patients. I have hemiplegic migraines with paralysis and Hashimoto's encephalopathy. So by accessing my memories of being the cybernetics tech in these Mars labs connected to the military bases, I was able to regain my knowledge of having worked with the drug serums, the biological ones, for doing immunoglobulin therapy to keep myself healthy on Mars, to prevent the hemiplegic migraines and the Hashimoto's encephalopathy. So that was done to me on Mars using biological drug serums to suppress these medical conditions. And I found out the procedures and protocols and diagnostic criteria from my memory recalls and hypnosis sessions of how to do this on Earth using biological drug serums, primarily through immunoglobulin therapy and treatments, either through intravenous immunoglobulin or subcutaneous immunoglobulin. So this is what I am describing in this medical presentation. The mechanisms of all that stuff, how it works, and how I came to find out how to do all of this through the self-hypnosis. Over the last 4.5 years, I am officially trained to do hypnosis, past life regressions, and soul retrieval as a shamanic practitioner, as an energy healer. I do have the certification for it. I chose to do self-hypnosis because for me that works best. I do have some hypnosis practitioners that I've trusted over the years. I've done quantum healing hypnosis therapy and it was helpful, but I needed more and the help for my own health and safety to improve my health. So that is why I did the self-hypnosis in conjunction with past life regression, which also taught me that I had several lifetimes as an extraterrestrial who had more plasma than humans do, and that plasma had regenerative qualities in the blood, which could speed up healing, which could mend broken bones, tissue damage, physical stuff in the body. It could mend it quicker if it was damaged. So that also factored in for me doing the medical experiment on myself, working with immunoglobulin therapy here on Earth. It was successful on Mars, also successful on Earth. That's why I did it on myself. I do recommend having the knowledge and certification for doing self-hypnosis on yourself or for others? Do you get trained in it? Do you know how it works? And whatever knowledge you regain from it or gain about yourself, make sure you use it wisely. If you do get medical information of some sort of training that you had from the Black Ops programs or secret space programs, make sure the medical knowledge or data is viable, that it can be used safely on yourself or others. Make sure you have medical doctors who are there for you to prescribe whatever you need, and that it's ethical and that it can work for you before trying it on yourself. I had to have medical professionals provide me with the immunoglobulin therapy treatments. I could not just dose myself. I could not prescribe it for myself. I had to work with medical professionals in order to gain access to the intravenous immunoglobulin IgG therapy and the subcutaneous immunoglobulin therapy, SCIG. I could not access these medications on my own. They're biological medications approved through mainstream medicine, and they're off-label treatments for me. So it had to be approved by medical professionals, and I had to get some basic nurses training to do the home infusions SCIG, and I had to go to an outpatient clinic to get the intravenous infusions of the immunoglobulin therapy. So I have always been monitored by medical professionals for doing the biological medications here on Earth, always. I didn't do it on my own. I didn't get diagnosed on my own. I had all the appropriate medical testing done to get proper diagnosis and to get proper medical treatment. I did use self-hypnosis to figure out what kind of medical treatment that I needed for myself in order to improve my health, because the standard medications were not working. So it had to be off-label, rare biological drugs that I needed, which is pure human plasma through immunoglobulin therapy. That's my treatment. That's what works for me. It could be different for other people, and your circumstances might be different in what memories you retrieve through the hypnosis and what you find out. So please either have the self-hypnosis, have yourself certified to be able to do it on yourself, or please get access to a hypnosis therapist who's a professional and certified in it to help you with the hypnosis sessions to be able to successfully retrieve memories, get help with any psychological or physiological improvements that you would like to have done in your health to improve your emotional states or physical states of well-being. Thank you so much. Hi, it's Ileana here, and today I would like to discuss some of the results that I had gotten from my self-hypnosis sessions from 2016 going on to all the way close to 2019, literally, so about 4 years. So what I had done was memory retrieval and self-hypnosis in order to remove my migraine white matter lesions and treat Hashimoto's encephalopathy. So basically, my self-hypnosis focused on the memories from the Cybernetics Labs, working on Mars, attached to the bases. So the labs were attached to the bases, and I was basically a cybernetics technician working for them, making cyborgs for planetary corporations, as well as working with biological drug serums to cure autoimmune disorders, different types of diseases. They also have cloning technology, holographic medical pods, Meditech units, and regeneration tanks in these Cybernetics Labs. And I was basically an end user technician working with those medical technologies. And it's 200 years more advanced than what we have medically here on Earth. So I decided to try on myself the biological drug serums because they had given them to me on Mars to basically reboot and boost my autoimmune system and to also stop the migraines because I had those medical conditions on Mars as well. And that's a harsh climate to live in and work in. So I was given drug serums every month to basically suppress my disorders and diseases and to keep me perfectly healthy, and it worked for 60 odd years when I was up there. So I thought, hey, since it worked there, why can't it work here for me? So I decided to replicate the experiment and try using human plasma, donated human plasma, which is called immunoglobulin therapy or intravenous immunoglobulin IgG therapy or subcutaneous immunoglobulin therapy. And it actually worked, and I'm just going to present it here and show some medical evidence and why it did work. By learning self-hypnosis and doing active hypnosis sessions for 4 years on myself, starting in 2016, I was able to access my subconscious memories of having worked for the planetary corporations at the Cybernetics Laboratories attached to the Mars bases. As well, through doing past life regressions and soul retrieval on myself, I had learned that I had a previous lifetime as an extraterrestrial who had blue blood with larger amounts of plasma than humans on Earth have. This CT plasma could quickly heal wounds and regenerate the physical body to stop diseases and repair bodily damage. The information that I was able to retrieve from my self-hypnosis sessions included having medical knowledge about biological drug serums, which are capable of regenerating the body and resetting the autoimmune system, as well as fixing neurological brain function damage. So basically, what I was doing with the self-hypnosis was looking for actionable medical data that could literally help me to regenerate damaged brain function, basically to remyelinate the neurons and axons and the myelin sheaths of my brain. And what myelin sheath does is when the brain sends electrical signals, messages for the body to function, since I had brain damage and white matter lesions from the migraines and the autoimmune disorder, basically those signals were being mixed up and misunderstood because the myelin sheaths had literally demyelinated. So there wasn't enough myelin around those myelin sheaths, and the neurons and axons were being affected. So that was the brain damage. So I wanted to reverse that. And I was looking for actionable data from the self-hypnosis of what I was involved in on Mars in order to literally help myself here on Earth. So I decided to use human plasma to see if I could remyelinate the myelin sheaths, reverse the damage on the neurons and the axons, and lessen the lesion loads of the white matter disease damage that was in my brain. And I was able to successfully do that with the immunoglobulin therapy IgG using human plasma antibodies to literally get rid of my white matter lesions in my brain and reset my autoimmune system so I don't have so much Hashimoto's encephalopathy flare-ups. So the Cybernetics Labs make human cyborgs as well as do cloning and are involved in hybridization programs that alter humans through genetic manipulation in order to combine extraterrestrial DNA with human genetics to make new species hybrids. These Cybernetics Labs also have holographic medical pods, portable Meditech units, regeneration tanks, and soul transfer technologies. From what I was able to retrieve from my hypnosis session notes is that the holographic medical pods and the regeneration tanks are medical technologies that are 200 years more advanced than what we have here on Earth for medical technology. So these regeneration devices allow to provide life extension, cure and reverse almost any type of diseases, regrow body parts, and even bring people back from the dead. On Earth, I am not a trained medical expert or physician. That is not the education that I had received. My formal education is library and information technology, as well as having certifications in shamanism, Reiki practitioner, crystal healer, energy healer, psychic development trainer, hypnosis, remote viewing, and Wicca teacher, which is white light magic. Since I had done the 60 and back through the Quantum Leap time travel program, working for several secret space programs, chief faction being planetary corporations, and also Nachtwaffen, which is called the Dark Fleet, I had 2 medical conditions because of this, so my health had started to deteriorate to the point where I could no longer work and had spent months in bed being sick. I'm not the type of person who likes to be sick. That's not me. I get very frustrated, I get angry, and I try to find solutions to help myself get better and to have the best optimal health that I can get for myself. I don't like disease. I don't like being sick, stuck in bed. That's just not me. The official diagnoses that I had gotten on Earth had been hemiplegic migraines and Hashimoto's encephalopathy. For me, the hemiplegic migraines cause paralysis, memory impairment, confusion, vision problems, and gait issues. The Hashimoto's encephalopathy causes memory loss, various multiple chemical sensitivities to foods, scents, or fragrances, fatigue, and chronic bodily pain. Not things you want to have. I wouldn't wish any of this on my worst enemy. I really don't. It's like the migraines, when it's hemiplegic migraines, it's like having a stroke, the symptoms of a stroke. Again, I wouldn't wish this on my worst enemy because it's not fun. You literally, it seems like you're disabled, you're stuck in bed, and you feel helpless. You also get anxiety and depression because when you have such symptoms as paralysis, you can't talk, walk, or speak. Or sometimes you have blind spots in front of your eyes, blindness, zigzag lines, or you hear ringing in your ears, and you have a throbbing, pounding migraine. With paralysis, it literally encompasses you and takes you over, and it's scary. It's really scary. So that was not fun for me. So I was looking for solutions to lessen that and even stop it if I could. After 2 years dealing with the symptoms of hemiplegic migraines and Hashimoto's encephalopathy, I decided that I would give my self-hypnosis notes a try and delve into a medical experiment project on myself where I would try biological medications like intravenous immunoglobulin therapy, IVIG, and subcutaneous immunoglobulin therapy, SCIG, to see if I could reduce or completely remove the white matter lesions in my brain, which were being caused by the migraines, as well as alleviate the Hashimoto's encephalopathy symptoms. I said to myself, I have nothing to lose, and if this medical experiment works, then it could drastically improve the quality of my health and way of life. And it did. To my surprise, A year and a half later, it did improve my health and my lifestyle as well. So the intravenous immunoglobulin therapy, that was done for 3 days at 100 grams, totally making it 500 ml over 3 days in March of 2018. Yes, that's when the treatment started. I came into an outpatient clinic. Every day I would go for 5 hours of intravenous immunoglobulin treatment from 8 a.m. or 9 a.m. and it was 5 hours each for the session for 3 days. The first day I noticed my vision refocusing, like literally not having blurry double vision anymore. That was one of the symptoms of Hashimoto's encephalopathy. My eyes cleared, my optic nerve refocused, my retinas refocused, and I could suddenly see clearly. Wow, that's after 5 hours of treatment the first day. My vision improved instantly. That's amazing. I was having blurry double vision for a year at that point every day. Wasn't having a migraine every day, but the migraine aura seemed to be every day. I'm thinking that's not normal. I don't think that's even migraine aura. I thought that was the encephalopathy. So to get my vision back, that was amazing, and I could also see better long distance. I can focus my eyes and see clearly without glasses. So that was amazing. And I have very strong prescription glasses for astigmatism. And I can't wear the glasses too long because it's just such a strong prescription. So it was a gift to me to literally have instant improvement in my vision after one session of the IVIG. So my vision refocused, I could see more clearly, and I was like, wow, this makes me happy. This is working. I could see the improvement, instant improvement. So I'm like, there's something to these Mars memories of having worked as a cybernetics tech. Instant actionable data. It worked. First day. And I continued to have better vision improvement over the other 3 days. And I could think clearly again. The memory lapses and confusion was gone. I got my photographic memory back. So I thought to myself, wow, amazing. But I need more. And unfortunately, the IVIG had some side effects, which was myoclonic jerks, vomiting, and migraines. Those were the side effects, and also fever after doing it for 3 days. So I had some reactions. So I thought to myself, okay, this really did help me, but I need something different. Still need to get myself the immunoglobulin therapy, obviously. How do I get that in my body other through intravenously? So I thought, you can do it subcutaneously through home treatment program. From the same outpatient clinic, you get the training, and then you start to do the home infusions on your own. So I got the basic nurses training several months later when it was approved. I went for a couple of weeks of training. I learned how to do it myself, and I've been doing it for the last 2 years. And it's literally removed the white matter lesions in my brain. And I no longer have the vision problems. I have still kept the benefits of it. Not being confused all the time. My photographic memory is back. The food sensitivities have been lessened to some degree, as well as scents and fragrances. I can breathe better. I'm not coughing all the time, which is another great benefit of this. So literally, the IVIG and the SCIG has reset my autoimmune system. So I'm not constantly stuck in bed like I was before. I still can't work full time, unfortunately, because the fluorescent lights and LEDs affect my vision in my brain, so I get migraines. So I have to have specialized type of lighting in order to function correctly. But I'm out of bed, I'm walking more, my health has improved. So I'll take this, it's a win. So the Mars memories are true and it worked for me. So this experiment has been successful as far as I'm concerned. I remembered that on Mars, the biological medications would suppress all my medical issues and also reverse the aging process. So I was being kept young all the time and was not aging. From doing some research on the biological medications that are available on Earth, I learned that immunoglobulin IgG and other types of immunoglobulin therapies can lower inflammation in the human body and reset the autoimmune system so that it does not continuously attack the body, thereby lowering the autoimmune response, which unnecessarily attacks human tissue, nerves, antibodies, thyroid, brain, etc., when the autoimmune system does not function correctly. Immunoglobulin is described as follows in the medical article Immunoglobulin G for the treatment of chronic pain, report of an expert workshop. Human immunoglobulin G, IgG, concentrates are immune-modulating anti-inflammatory blood plasma derived products that can be applied either intravenously, intravenous immunoglobulin IgG, or subcutaneously, subcutaneous immunoglobulin SCIG. Converging evidence supports the concept that IgG may represent a valid treatment of pain associated with some established peripheral neuropathies, such as those in diabetes, mellitus, DM, and Sjögren's syndrome, SS, and a range of pain conditions, including fibromyalgia, FN, complex regional pain syndromes, CRPS, post-polio syndrome, PPS, and pain associated with specific autoantibodies that are likely to interfere with specific receptor targets. Despite their pathophysiological heterogeneity, most of these chronic pains are categorized by evidence of abnormal local and/or systemic cytokine production. The analgesic action of IgG in these conditions might thus be explained through synergistic effects of some of the large number of already established IVIG mechanisms of action, including modulation of cytokine expression and function and immunosuppression. Basically, the cytokine levels are decreased by using IVIG or SCIG, and it literally stops the immune system from rampaging in somebody's body and causing wreckage and stuff. So that's what it means, immunosuppression. It stops those actions. Basically, the dirty antibodies are cleaned up and you get fresh, clean antibodies in your whole body. So it resets your autoimmune system. I see antibodies that are not clean. In essence, they're just like a bio-waste product of the disorder or whatever autoimmune system disease that somebody might have. It makes negative antibodies. I look at it, okay, it's bio-waste. It needs to be cleaned up. So how can you introduce new, fresh, clean antibodies into the system? And that's what IVIG and SCIG does, because it's literally pure, clean, donated human plasma that regenerates your body and resets your autoimmune system. So it flushes out the negative, dirty antibodies and gives you a fresh set of antibodies. to do the work and have you having a good autoimmune system that's relatively healthy. Immunoglobulin therapy is also known to manage the reduction of symptoms for encephalopathies like Hashimoto's encephalopathy and to reduce white matter lesion loads in multiple sclerosis MS patients, as well as to stop the growth of white matter lesions for patients with migraines. From my hypnosis regression memories, I knew that the biological drug serums derived on Mars had anti-inflammatory properties designed to reduce any type of inflammation anywhere in the body. So I decided to try out the Earth immunoglobulin therapies to see if it would have the same results for myself. I researched all the benefits that immunoglobulin therapy could provide me, and that there are almost no side effects except site injection reactions. So I decided to try it out on myself, and it has worked really well for me, as my white matter lesions are gone from the brain, and also the Hashimoto's encephalopathy symptoms have been reduced. So I feel 50% more healthier than I did 2 years ago. To me, this shows that my experiment with doing immunoglobulin therapy has been a great success, and I am continuing doing it every week. The research shows that I will need to be on immunoglobulin therapy for the rest of my life in order to keep the same level of health improvement that I have now. I don't plan to regress backwards in my health. I don't want that or need that, so I do need continual infusion of human plasma to basically regulate my autoimmune system and to make sure I don't have any inflammation in my brain so the white matter lesions don't return. That's in essence what the subcutaneous immunoglobulin therapy is doing for me. In order to prove the efficacy and success of my medical experiment, 5 MRIs had been done to monitor the white matter lesions from 2017 to 2019, and the last MRI scan showed that the lesions are almost imperceptible. Now as well, the blood work shows that my thyroperoxidase TPO levels have lowered, so the Hashimoto's encephalopathy is under control, and I am not exhibiting too many flare-ups. So the subcutaneous immunoglobulin therapy has indeed worked for me and has helped me to make my overall health much better than going back 4 years ago, for example. I am the type of person who needs to see actionable medical and scientific data through both physical health improvement of medical conditions as well as the various test results that will reflect the positive changes that are happening within my body in order to have proof that the biological medications are working to reduce the disease or disorder symptoms. I don't simply believe that I have psychosomatic disorder where basically stress and anxiety and negative thinking is causing all my medical conditions, or that woe's me, I was in the secret space program for 60 years on Mars, and as of the result of what they did to me by being there too long, I have all these medical conditions. I think that sometimes it could be psychological factors, it could be environmental factors, and it could also be genetic factors. So I'm getting genetic testing done for migraines, encephalopathy, ataxia, epilepsy, mitochondrial disease, seizures. I'm getting all that genetically tested to see, perhaps, is this part of my genetics? Is it environmental? Is it partially psychological? So I'm looking into all of those factors because I don't simply accept, it's psychosomatic, you did this to yourself with negative thinking. I don't accept that. I don't think that's how it truly is, because the biological drug serums here on Earth did help improve both my medical conditions. So if medication is helping me, it can't be all psychological. There is some root cause of medical conditions that need human plasma to treat the conditions. In my case, the MRI results do show that the white matter lesions in the brain are gone, and that my Hashimoto's encephalopathy is not as active as it had been 3 years ago. So accessing my subconscious memories of having worked as a cybernetics technician on Mars, as well as exploring my past life as an extraterrestrial with blood plasma that has regeneration properties to self-heal the body, helped me in my present life to improve my health, as well as to provide me with physical evidence that some of the Earth biological medications, like Immunoglobulin IgG therapy, is very much an equivalent of what is used in the Mars Cybernetics Labs to treat SSP assets in order to suppress any of their medical conditions and keep them constantly healthy while they work for the secret space programs. There's no coincidences here. I don't believe that. However, when the SSP assets are released from their service duties and returned back to Earth, then they no longer have access to the SSP drug serums and advanced medical technologies that would always keep them healthy. These SSP assets are back to square one with having their medical conditions and needing to look for viable sources of medical treatments on Earth that might not be as successful as what Mars has, that can permanently remove medical conditions, so disease or conditions become only manageable with various drugs with a lot of side effects that are not conducive for a healthy way of life, as a result creating the need to consume many drugs in order to stay alive and even survive. So basically meeting life expectations and life needs, sometimes barely surviving. For my case, I'm lucky that my subcutaneous immunoglobulin therapy has 0 side effects for me, as this biological medication is pure, donated human plasma, and that there is almost no risk for me as a patient being on this biological medication for prolonged periods of time. The SCIG has done wonders in treating my Hashimoto's encephalopathy to the point where my autoimmune system receives a constant boost, so I am no longer fatigued so much, having more energy to get out of bed and live. My allergic reactions are lessened, so I do not constantly cough, wheeze, or feel a tightness in my throat. There has been some reduction in reactions to different scents, smells. So basically reducing the multiple chemical sensitivities, as well having less myoclonic jerks and joint pain. From what I understand of the immunoglobulin mechanisms, it reduces the inflammation processes in the body, so it lowers having allergic reactions to eating gluten foods, thereby allowing to have a broader food selection. As for the hemiplegic migraines, the SCIG has also reduced the inflammation process in the brain, so there are lesser migraines now to some extent, thereby lowering the white matter lesion loads. Memory lapses have been reduced, and I have better clear thinking, having my photographic memory back, as I had mentioned before. The double blurry vision caused by the migraine auras has also stopped to a significant degree, as I had a daily, and the SCIG has helped to reduce this. I also practice avoiding being exposed to the main migraine trigger that I have, which is not being under any fluorescent or LED lighting, as the flickering or brightness from these light sources does instantly trigger a hemiplegic migraine episode with paralysis. I can only function while being around frosted incandescent and halogen light bulbs. That does not seem to trigger migraines with or without aura. What I have noticed is that the SCIG does provide some reduction in light sensitivity, so my eyes and brain get less confusionary signals that could cause the body to malfunction and create the migraines and auras that accompany them. I'm cognizant of my various migraine triggers, which can be caused by lighting, food, scents, and noise, so I practice mindful avoidance of these triggers in order to not cause unnecessary migraine episodes, as I am aware that too many migraines can cause white matter lesion growth or risk for strokes. As well, I do a lot of meditation with metaphysical music and listening to different types of guided meditations to basically relieve the anxiety that I sometimes have, because migraines are scary. So is encephalopathy symptoms. So I've tried different antidepressants and anxiety meds and stuff, and none of it works on me. Just the side effects make me even more sicker. Since that doesn't work on me, I've tried a lot of different medications. I am using the alternative natural methods of meditation, a couple of hours a day whenever I can get it in, and also relaxation by taking walks and deep breathing. That really does help to alleviate the anxiety. Since meds don't work on me, might as well do something that's more natural, and it does. I'm not against medications for anxiety or depression. For some people it works, for some people it doesn't, or there's a middle line where it works to a certain degree. Just nothing worked on me, so I do the meditation, the guided relaxation, the music, all that stuff, walking and deep breathing. It does help for me. So to provide complete disclosure, for this video, I'm just going to describe in the way that I use self-hypnosis for myself, for my personal reasons. I wasn't using the self-hypnosis to treat psychosomatic symptoms like chronic pain, migraines, sight issues, or negative thinking patterns. I was using self-hypnosis to do deep data diving and data mining for pure medical information on the drug serums that had been used on Mars, primarily the plasma infusions to improve autoimmune disorders, get rid of lesions, reset the autoimmune system, that kind of stuff. That's what I was going back through my hypnosis notes looking for, what had been in my memories, to actually use it to find equivalents for earth medications that are biological drugs here. And that's what I did, and that's what I was able to do with the results of my hypnosis. Again, I was not using it for treatment of psychological issues. I was using it for physical medical treatments, looking for biological drugs. That was the specific target. So I sort of had a goal in mind of what I was looking for and why, to help myself physically improve my health with whatever medical knowledge that I was able to access through the self-hypnosis and the notes and audio that I had from those sessions over the last 4 years. Just to make that perfectly clear, again, I was not using hypnosis to treat psychological factors like anxiety or depression or negative thought patterns. There are several different types of hypnosis, and I was doing the medical information, the deep diving hypnosis, not the psychological treatment of issues that have anything to do with the mental component. Although the self-hypnosis did help me to work through the emotional trauma by deciphering all that data that I had from all those memories. So in a way, it did help me emotionally to come to terms with what happened to me on Mars, with the ET abductions, the alien incursions, all that stuff. I worked through a lot of emotional trauma, purging all of that with the hypnosis. So in a way, it did help with that stuff, because I acknowledged it and I said, well, Why don't you just use those experiences to help yourself to treat your medical conditions, your physical medical conditions, with actionable data that you can use with your medical knowledge? Don't just sit there, look at those notes. Actually experiment on yourself, use it. And if you have good outcomes, great. So that's what I did, and it literally paid off with the data load, the data downloads from those hypnosis sessions. It worked. So over the last several years, I have found myself to be taking on a medical research role for my own health advocacy and trying to design some type of medical criteria for diagnosing and treating Hashimoto's encephalopathy, as well as trying to reduce the symptoms of the hemiplegic migraine episodes as best that I can with the SCIG, as standard preventive migraine medications have not worked to reduce migraine symptoms. And I had tried Cybelium, I had tried Topamax, I had tried Diamox, all the standard meds for migraines, and didn't work. The SCIG works best to reduce the migraine auras and to clear the vision issues, as well as the multiple chemical sensitivities caused by migraines and the encephalopathy. So it's a mixed set of positive results. I'll take it. I chose to explore the medical data that was revealed from the various self-hypnosis sessions from the last 4 years in regards to using biological medications in order to reverse the autoimmune and neurological damage done to my body and brain by Hashimoto's encephalopathy and the hemiplegic migraines. In order to reverse the autoimmune and neurological damage done to my body and brain, so basically what I did in order to reverse all of that stuff, in essence, I put all of my trust and belief that the medical knowledge that I had on Mars working as a cybernetics technician was indeed real, and that this data is viably actionable for me to successfully use immunoglobulin therapy in order to get positive treatment outcomes for reducing migraine symptoms, as well as have treatment management for the Hashimoto's encephalopathy. Well, okay, why not just use the biological medications to literally go in, reverse autoimmune and neurological brain damage? Just do it. Just try it out and see if it works or not. Give it a shot. I'm like, immunoglobulin therapy can't hurt me. It's donated human plasma. They have strict protocols to literally filter out anything that's bad in it to make it clean. Like, they have very strict procedures for doing that. So, and it's safer to do it in the 21st century than at any other time. So I'm like, trust in it. See what happens if you have positive outcomes. So I did, and successfully treated it. So I literally used the medical knowledge gained from my memories of being on Mars, from working in those Cybernetics Labs, in order to create the various protocols for having diagnosis and treatment criteria for Hashimoto's encephalopathy, thereby being able to actually treat this medical condition and not have any negative repercussions from doing this medical experiment on myself, as well as doing the MRIs every couple of months. And I didn't have contrast for the MRIs. I wasn't radiated. It was perfectly safe. Every 6 to 7 months, I would have an MRI to see if the white matter lesion loads were being reduced. And after a year and a half, they were reduced to almost being imperceptible at all on the MRI. So it's a success. SCIG does really work, and IVIG to reduce inflammation in the brain and other parts of the body, to reset the autoimmune system, to boost it, and to stop the self-attacking process of the autoimmune system so it doesn't literally eat your body. It can be done and has been done. This experiment has been successful. Literally successful. By the time I was done having the white matter lesions being gone from my brain and having reduction in symptoms for the Hashimoto's encephalopathy, I had gained a large amount of medical forensic research that I had put together in order to be able to map out the actionable items I needed to have in order to successfully treat myself medically, where the migraines and encephalopathy no longer ruled the existence of my health and life. They're still there in the background, sometimes lurking about, but it isn't the sum of my life. It isn't the focus of my life. I want to be as healthy as I can be. I want the best optimal health I can get with whatever is working for me. So, SCIG it is. I have the medical test results proving that my white matter lesions are gone, and also that my thyroperoxidase TPO levels of antibodies are at lower rates. So, the intravenous immunoglobulin and subcutaneous immunoglobulin therapies have worked to treat my medical conditions. So you can't say, oh, you've gone through so much psychological damage, emotional outbursts, breaks, whatever. It's all psychosomatic. No, it's not. It's environmental, it's probably genetic, and it's psychological. I think it's all three of those things combined together. It's not just one item. The emotional trauma, yes, it was there. Yes, that was in the self-hypnosis as well. Working on Cybernetics Labs. They do butcher people and make cyborgs from body parts. They kill people. It's not pretty. It's traumatic and stressful, yes. Those factors are there. But it's not the sum of what could be causing my medical issues. As if, no. Unfortunately, it's more than that. So I had to take literally self-action to help myself, and that's what I did. So there is solid medical proof that I had done the right thing by examining my self-hypnosis medical data in regards to utilizing biological drugs, serums from Mars, in order to also use them on Earth, as well as taking into account the information about my past life as an extraterrestrial, that having more plasma in the body is conducive to and for creating regeneration of the body and resetting the autoimmune system. The self-hypnosis sessions, along with the past life regression and the notes that came out of those sessions, did turn out to be actionable medical documentation that can be applied on patients like me to treat migraines and encephalopathy with biological medications. Also, doing the soul retrieval did help to get rid of a lot of the emotional trauma that I had faced working on Mars for a 16-back secret space program. That's not pretty, it's not cool, it's not amazing. It's a job that I did for 60 years through a quantum leap time travel program. Literally time travel, quantum mechanics beyond what we can imagine. That's why it's called quantum leap time travel. So, in conclusion, to my way of thinking, the secret space programs do exist, and civilians who are smart and resourceful are used as SSP assets to work in black ops, clandestine programs on Earth and off planet. This presentation has 17 slides showing the medical protocols and processes that I went through, along with positive test results proving that biological medications are viable in treating migraines and encephalopathies. I am not a trained medical professional, yet I have the memories from Mars of being a cybernetics technician who had been trained to work in medical laboratories creating human cyborgs and having the genetic knowledge to make human ET hybrids. So this presentation features a lot of the medical jargon and protocols for treating rare medical disorders, because that is what I have stored as knowledge in my brain still to this day, and I choose to utilize this information to medically help improve my own health. This is a skill set that I regained from doing self-hypnosis and exploring memories that come from my Mars SSP Asset service and past lives as an ET. All the information in this presentation is based on the medical work that I have been pursuing on my own to help myself to better manage my medical conditions and to improve the quality of my health and well-being. This has happened because I made it a priority to work with self-hypnosis and to put in the time to do the past life regressions. My positive results for better health and lifestyle changes are a decent result of these choice outcomes and choices that I made to literally change my life and the way I think about things. To me, reality is not linear. It goes beyond that. There's so much that's hidden and that is illusion of what's on the surface of Earth. There's so much more beneath the illusion, beneath just the 3D. I chose to dive deep and explore that, and I got some interesting outcomes, positive results from doing that. Take a deep dive, get a lot of medical data from self-hypnosis, spend the time to medically experiment on myself and see what happens. And as a result of all of this work that's been done, my health has improved 50%, and I think that's a positive outcome for making all those choices and doing the work for it. Medical experiment outcomes. The IVIG and the SCIG therapies have restored the myelin sheaths in my brain, so the new myelin has grown, repairing the damaged neurons and axons so that the electrical signals are being sent correctly from the brain to the body. The memory lapse issues have also been stopped, and I have my idiotic photographic memory back, so I don't have to make notes anymore so much. And because before doing the IVIG and SCIG, at that time it was hard for me to remember situational things of when, where, how, and why, so I had to take a lot of notes in notebooks. Now I don't have to rely on that so much to keep track of important things, because my memory is back to normal as it was before the white matter lesions in 2017. So I have a very clear memory again, and I'm not relying on notes. So the demyelination has been stopped by introducing the Immunoglobulin IgG treatment. So that has lowered the inflammation as a result in my brain, thereby promoting remyelination, and the white matter lesions have been removed, as will be shown on the MRI results. There has been some reduction in migraine triggers like food and scents. I'm not triggered so much by the gluten anymore in terms of stomach pain and migraines, as well as there's less paralysis episodes happening and less aura symptoms of the blurry double vision. I don't have that anymore every day. Like I said, double blurry vision has stopped, so the daily occurrence isn't happening anymore, because the SCIG infusions have basically boosted the autoimmune system and have reset the autoimmune system. So it's basically acting as a barrier not to damage the autoimmune system. The SCIG itself, the weekly infusions, are the barriers that prevent the autoimmune system from attacking the rest of my body and brain. There has been 50% in health improvement, as many symptoms of the encephalopathy flare-ups happen less now. I did follow the proper medical protocols for the SCIG treatment to get optimal results without hurting myself, the patient. The MRI results are clear. There's no more white matter lesions. The loads have been reduced, so it's almost imperceptible now on the MRI. It's a weak T2 signal. And blood work shows lowered thyroperoxidase, TPO levels. So the Hashimoto's encephalopathy is being managed with the SCIG treatment. The IVIG and SCIG treatments have been documented and medical testing conducted to make sure that treatments were viable and working for the patient, me, to improve their medical conditions. So everything was done ethically and viably with actionable data, medical data to back up the efficacy and viability of the IVIG and SCIG treatments for myself. So the medical data shows that improvement has been done, 50% on my health. MRI is almost imperceptible of that white matter lesion shrinking completely. It almost can't be seen on the MRI results anymore. So I won't be doing the MRIs every year like I was doing before, every 6 months to a year. I won't be doing that anymore because it's shrunk to the point where it almost can't be seen on the MRI. And the T2 signal is also not so high anymore. So there's no point doing the MRI every 6 months to a year's period of time. Maybe I'll get it done in a couple of years to see how things are going in my brain, but I prefer not to go in every 6 months to the hospital in the evening to do the MRIs. I'd rather be healthier and feel better and not have to do that. Just continue on with the SCIG so I could limit the amounts of MRIs that I would have to do. So I'm still very much the type of person that likes to see medical facts for proving things. Even for myself, at the back of my mind, I always have this thought, well, prove it. Why don't you just prove it if this is actionable data? If you think your self-hypnosis notes are correct, that you worked in the Cybernetics Labs on Mars, and you know all this information about biological drug serums, and you're planning to try this on yourself, find an equivalent of that here on Earth. Deep dive for medical research to see if what's in your brain is real. I'm like, okay, have the Mars data. Now time to find the Earth data to back it up. Because, hey, I need to know what to ask the neurologist when requesting human plasma. It has to be called something. So I started off with the following 2 articles. The first one was Intravenous Immunoglobulin in Multiple Sclerosis, Clinical and Neurological Results and Implications for Possible Mechanisms of Action. Now, I know I never had multiple sclerosis, MS. No, never had multiple sclerosis. They did the spinal tap for it. There were no ugly clonal patterns. So, and the MRIs, the lesion loads, they didn't have the pattern of what is there for MS. First of all, they were like kind of medium sized, not large. So that didn't fit the pattern of MS. But, hey, if the question that I asked was this, if IVIG can reduce or even remove white matter lesion loads in MS, multiple sclerosis, why not try IVIG and SCIG on hemiplegic migraines and Hashimoto's encephalopathy to remove and shrink the white matter lesions. So that was basically the sticky note that I put on that article. I'm like, well, if you can remove white matter lesions in MS patients or reduce the lesions, you can do the same with white matter lesions that are caused by migraines. Same type of white matter lesions, just bigger in MS than in migraine patients. So why not try it out? And from reading the article, these are the following things that I circled that I thought would help me in this research. Several possible mechanisms by which intravenous immunoglobulin IgG modulates the course of the disease are related to limiting the inflammatory process and repairing the damage by enhancing remyelination. In the current study, the positive impact of IVIG treatment on arresting disease progression was evident by decreased brain magnetic resonance imaging MRI scores of the lesion area. So the lesions basically decreased after doing IVIG for several months. For those MS patients, the lesion loads were reduced. Interesting. So that sort of proved my hypothesis. All right, use IVIG and SCIG to reduce migraine lesions. It's not MS, it's migraines. It's not as bad as MS even, so it should be easier to do, and it was. Consequently, therapeutic approaches applied in MS include strategies aimed at immune suppression or immune regulation of the autoimmune inflammatory process in the brain and spinal cord to arrest disease progression and to prevent myelin destruction. Well, my MRI scans showed that I had demyelination and migraines. So what's the antithesis of demyelination? It's remyelination of the myelin sheath. So the neurotransmitters then function better and send better electrical signals to the neurons and axons when you've remyelinated your myelin sheaths. Your brain basically works better, and the signals actually get through the myelin sheaths when you have more myelin and it's no longer damaged. By reducing the white matter lesion loads, you remyelinate the myelin sheaths. Therefore, memory lapses, confusion was gone, and my body wasn't doing weird myoclonic jerks and stuff, and the signals were being interpreted better by my brain. I'll take it. 50% improvement. I'll take it. So that was the interesting fact. And it also said that the authors conducted an open controlled trial to evaluate the effect of IVIG on exacerbation rates of 20 relapsing remitting MS patients. IVIG treatment was given to 10 patients at a dose of 0.4 G per day for 5 consecutive days at the beginning of the study. Additional booster doses were administered once every 2 months for the next 12 months. In the IVIG treated patients with MS, the annual exacerbation rate decreased from 3.4 ratio down to 1.2 before treatment to 1.0 to 0.7 after 1 year, while the untreated patients with MS continued to experience a similar relapse rate. These results suggested that IVIG suppressed the ongoing pathological process in MS and thus prompted continuation of the treatment for a period of 3 years. An additional significant decrease was evident during the second and third years of IVIG treatment. So basically, respectfully and correlating inversely with the duration of treatment. I'm not going to say all the numbers. And with neurological disability after 3 years, basically acute exacerbations were influenced by IVIG and reduced, and white matter lesions were reduced. So that's what reading all that stuff said. Basically, the numbers show exacerbation rates of symptoms had reduction with doing IVIG for up to 3 years. So that's good. MS patients can get some relief symptoms while being on IVIG, and MS is not a laughing matter. It's a serious autoimmune disease that's either treated with corticosteroids, IVIG, and some other biological medications that are available. So there are some different treatments available for MS, and it will be different for each patient how they'll be treated for the type of MS that they have, because there's several different types. And the next article was the role of immunoglobulin therapy in allergic diseases. So the question I asked myself on the sticky note, if IVIG works to reduce asthma and other allergic diseases, why not try IVIG and SCIG to reduce the multiple chemical sensitivity symptoms that I was having? So I highlighted some interesting things in this article. More recently, IVIG has been shown to have anti-inflammatory activity when used at substantially higher concentrations. A number of studies have examined the efficacy of IVIG in allergic diseases. For patients with severe refractory asthma, sinusitis, atopic dermatitis, and urticaria, IVIG offers an alternative therapy with relatively few side effects. Although the mechanism by which IVIG may attenuate the allergic response is still undetermined, clinical studies have shown that immunoglobulin therapy can decrease serum IgE levels and increase glucocorticosteroid binding affinity. Glucocorticosteroid binding affinity, while in vitro studies have shown that IVIG can decrease T cell secretion of Th2 cytokines. Further studies are needed to confirm the initial encouraging results seen in allergic patients with severe resistant disease. Now, I don't have asthma. I don't have any of these diseases listed here. What I have is just multiple chemical sensitivities to foods, to scents, fragrances, basically hypersensitivities and allergic reactions, like coughing, wheezing, tight chest, tight throat symptoms. That's what was going on. And the IVIG and SCIG basically stopped the coughing. So I'm no longer hacking away every day, like coughing like I've been smoking or something, and I don't smoke. I'm not a smoker, so there's no rhyme or reason for why I would be coughing every day. And I don't have any bronchitis issues or any lung issues, so it didn't make sense why I was coughing. And I wasn't even being exposed to anything. It was a chronic cough for about a year that I was having. So I think it was autoimmune related and a lot of allergies because of weak autoimmune system. So the SCIG and IVIG literally reset my autoimmune system, stopped the coughing, and stopped the allergic reactions that I was having. I was having allergic reactions to nothing. Even the cognitive behavioral therapy didn't help to stop the coughing. Self-hypnosis didn't stop the coughing. Tried everything. Meditation didn't stop it. I'm like, well, maybe it is medical. Maybe it is autoimmune related. So having more clean human plasma in my body is helping. It is suppressing the allergic reactions literally in my body. So reset autoimmune system and no more coughing. There it is. So going back to what I was talking about earlier, to have some kind of efficacy and viability data to understand why the SCIG and IVIG would be actionable data to use in medical purposes to treat Hashimoto's encephalopathy and white matter lesions. What's the scope? What's the data? So in the United States and Canada, which is both North America, there is no specific diagnostic criteria for how to treat Hashimoto's encephalopathy. There is criteria and protocols in Japan of how this is done, and they follow the strict criteria protocols for this. So I thought, okay, why don't I basically follow the criteria from Japan and put it all together in a bit of more detail for myself, enlarge the scope. So I did a medical proposal for diagnosing and treating Hashimoto's encephalopathy. I created this documentation and I outlined the synopsis for the project scope. I said diagnostic criteria, testing criteria, and treatments criteria for Hashimoto's encephalopathy technology. So I added on to the Japan criteria and protocols, I added on more to it with what I think needs to be in there, basically to create the criteria to expand it, not just for treatment, but diagnosis and testing as well for Hashimoto's encephalopathy. So for me, the diagnostic criteria includes looking at blood serum comparables, examining symptoms and other diagnostic findings. Testing criteria includes doing testing of blood serums, spinal tap fluid, CSF analysis, MRI, CT scans, brain SPECT, PET scan, and EEG scans. Treatments criteria include corticosteroids, various forms of immunoglobulin therapy like IVIG or the subcutaneous immunoglobulin therapy, SCIG, and plasmapheresis as well, which is basically when your own blood is extracted from your body, a certain amount, it is put through a filtering process, and then it's the clean antibodies from the blood being separated from the plasma, it's reinserted back into your body. So the plasmapheresis, the plasma itself from your own blood, is now clean with clean antibodies, and it's reinserted into you, and that's basically the last option. Some people can do it, some people can't, because if you have anemia or low ferritin counts, then some people can't do the plasmapheresis because of that. And then I provided a description of the technology. So the diagnostic criteria of Hashimoto's encephalopathy technology, what I said is that I looked at the Castillo et al. Documentation called Hashimoto's encephalopathy, a rare protoform disorder. That's the Japanese criteria. So basically, I divided it up in sections, and I also added on some things in the middle of the documentation about testing and diagnosis as well. So the first, number one, is encephalopathy is manifested by cognitive impairment in one or more of the following: Neuropsychiatric features, example, hallucinations, delusions, or paranoia, myoclonus, generalized tonic-clonic or partial seizures, or focal neurologic deficits. So that's basically the criteria for diagnosing Hashimoto's encephalopathy. Number 2, presence of serum TPO-A, thyroperoxidase antibodies. Euthyroid status or mild hypothyroidism for number 3, basically TSH more 20.0 ml that would not account for encephalopathy. So number 4, no evidence in blood, urine, or CSF. Spinal tap, analysis of an infection, toxic metabolic or neoplastic process. Number 5, no serologic evidence of neuronal voltage-gated calcium channel, voltage-gated potassium channel, or other currently recognized paraneoplastic autoantibodies to indicate another diagnosis. No findings or neuroimaging studies indicating vascular, neoplastic, or other structural lesions to explain the encephalopathy. That's for number 6. And for number 6, I had the white matter lesions, which can be caused by migraines or encephalopathy. So it was ruled out. I don't have multiple sclerosis. I don't have any other vascular disease or disorder that could cause the lesions. It's migraines and suspected encephalopathy, Hashimoto's encephalopathy. Number 7 is complete or near complete return to the patient's neurological baseline status following corticosteroid treatment, and in my case, IVIG and SCIG treatment. So 50% improvement in health is my baseline status, what I could return to. So that counts toward meeting the criteria, basically. And then I just went on to describe the diagnostic findings of Hashimoto's encephalopathy. And I adopted and modified that from Ashfari et al., Castillo et al., Chung et al., Marshall et al., Ferrasi et al., Shachari et al., Hillobirth and De Hollanda et al. Source is Hashimoto's encephalopathy, a rare protoform disorder, the Japanese article where this came from, the original diagnostic criteria, and I did modify it to expand on it. So basically the following are the diagnostic findings, percentages, occurrence ratings for the different things that could be elevated in testing, blood work, etc. for findings of Hashimoto's encephalopathy. Starting with the anti-thyroid antibodies, having the elevated anti-TPO antibodies, it's 86 to 100%. And my levels were very high, so I did need to lower the TPO counts, and that will be shown later on in the blood work results. Elevated anti-IgG antibodies, 73%. Elevated anti-TSH/R antibodies, 10 to 20%. Thyroid hormones, euthyroid or subclinical hypothyroidism, 65 to 75%. I had been originally diagnosed with hypothyroidism in 2010, and my TSH levels were high, so that was lowered by using the desiccated thyroid medication, which I will have to be on for the rest of my life to make sure my thyroid is healthy and that my TSH levels are also healthy. So clinical hypothyroidism, 16 to 20%. Clinical hyperthyroidism, 5 to 7%. CSF analysis, spinal tap, elevated CSF protein 60 to 85%. I never had elevated CSF protein levels, so that indicated that it was Hashimoto's encephalopathy, not another type of encephalopathy. Mild lymphocytosis, pleocytosis 6 to 25% positive, anti-thyroid antibodies 62 to 75%. Now that showed up in my blood work, not in the spinal tap itself. The blood work still counts. Elevated IgG synthesis 14%. Oligoclonal bands 8 to 33%. Anti-NAE antibodies 65 to 68%. That test is not done in the United States or Canada. It can only be done in Japan. So I couldn't do the anti-NAE antibodies test, although I requested it. Couldn't be done because it's only done in Japan. Abnormal EEG scans, typically non-specific slowing of the background of the brain waves, 85 to 98%. My EEG has always been clear and normal. Abnormal CT or MRI, typically non-specific changes, 36 to 49%. I had the white matter lesions in my brain on the multiple MRI scans, so that was the abnormal non-specific findings that pointed to the migraines and Hashimoto's encephalopathy. Then the brain SPECT, focal hyperperfusion 73%, global hypoperfusion 9%, normal findings 18%. I had the brain SPECT done and it showed increased cerebral perfusion, blood flow. And that correlates with having chronic anxiety and depression symptoms. That can often be symptoms of encephalopathy in migraines. It's comorbid with those two disorders, actually. And the other one is the TPO-AB and thyroperoxidase antibodies. That's what it stands for. TGAB, anti-thyroglobulin antibodies, TRAB, TSH receptor autoantibodies, and that was all normal for me. The anti-NAE antibodies directed against the amino NH2 terminal of A enolase. I couldn't get that test done because that's only done in Japan. And then I went on to break down the testing and treatment diagnostics of the technology. So basically, you have to check a bunch of different antibodies to make sure and rule out encephalopathy or Hashimoto's encephalopathy. I'm not going to list all of that stuff because it's a lot. I'm just going to say algorithm for the diagnosis of Hashimoto's encephalopathy. Exclude all these serum antibodies as negative to cross off having vasculitis or limbic encephalopathy. So there could be different types of encephalopathies. So this criteria gives kind of like a list of what you have to exclude from those encephalopathies to rule them out, to make sure it's just Hashimoto's encephalopathy. It's pretty long names, a lot of them. I'm not going to list them. So, but you do have to exclude all of that stuff to figure out what kind of encephalopathy a patient has. I had the raised TPO thyroperoxidase levels, so that's how it was diagnosed that I have Hashimoto's encephalopathy. And I had a lot of blood work done to rule out the other antibodies on this list, and I had the spinal tap done to also rule those things out. So number 2 is algorithm for the treatment of Hashimoto's encephalopathy. So your TSH, thyroid stimulating hormone, has to be checked. FT4 free thyroxine, FT3 free toluidothyronine, TPOAB anti-thyroperoxidase antibodies levels have to be tested. TGAB anti-thyroglobulin antibodies, TRAB thyrotropin receptor antibodies, anti-NAE antibodies directed against the amino NH2 terminal of ANLase antibodies. So that has to be checked as well. And my TSH levels are checked every 4 months. Sometimes it goes up or down. And I've had to increase the medication of the desiccated thyroid to 75 mg last year to, balance my TSH hormones. FT4 levels and FT3 levels were also going up and down, and I managed to balance that out with the IVIG and SCIG. And the anti-thyroperoxidase levels, they were at the 3,000 point mark, 3,000 something, close to 4,000. And that happened because I was exposed to radon gas in Kelowna. Before that, it was 500 something when I lived in South Surrey, BC. Because I was exposed to the radon gas, unfortunately, the TPO levels went up and it triggered the Hashimoto's encephalopathy, triggered the symptoms of it, and it made my migraines worse. So that's why I went on the IVIG and SCIG treatments to lower the thyroperoxidase levels, to get the encephalopathy under control, and to try to alleviate the migraine symptoms and to remove the white matter lesions from my brain based on this criteria that I spliced together from the Japanese article and stuff that I added in to this criteria. Number 3 is first line of testing for Hashimoto's encephalopathy is the serum TSH, FT4, FT3 anti-TPO, anti-TG, TRAB, anti-ANLase, NAE antibodies. So those are the first things that should be tested. All of that was tested for me. And, my anti-TPO antibodies were pretty high. So that was a big tell that I had Hashimoto's encephalopathy. Currently, neither Canada nor the United States medical systems, they do not provide any type of testing for the anti-NH2 terminal of alpha-NLase NAE serum. This is considered to be one of the most important serum testing to identify the markers for Hashimoto's encephalopathy, and that's not available in North America. So that's a big issue. So I was not able to get that testing done. So number 4, second line of testing for Hashimoto's encephalopathy is the CSF spinal tap test, anti-TPO levels in the spinal tap, anti-TG levels, 14-33 protein, oligoclonal bands, CSF proteins, and raised immunoglobulin levels. That's all the medical stuff that's tested in the spinal tap. The fluid that comes from the spinal tap itself. And spinal tap is when a needle is inserted into your back, when there's you've been numbed with antiseptic and the medication. So basically your back is numb. They have a needle with a syringe. They extract the spinal tap fluid from your back, and that's how they test all of this autoantibody levels from the CSF spinal fluid. So number 5, third line of testing for Hashimoto's encephalopathy is neuroimaging scans. Brain SPECT scans often disclose hyperperfusion, increased cerebral perfusion. That's what I had. Or decreased perfusion. PET scans often disclose hypometabolism and raised hypometabolism. And PET scans in particular are often a deciding factor in confirming the diagnosis. Here in Canada, the brain SPECT, they chose not to look at those findings for a firm diagnosis. Instead, they chose to go with the anti-TPO levels, that they were too high and that my MRI scans were not normal. They chose to look at the factors of the white matter lesions. So MRI scans often disclose a large spectrum of non-specific abnormalities like focal or confluent white matter lesions, diffuse white matter, and cortical and subcortical white matter demyelination. On my MRI, I had the deep white matter lesions and the demyelination factor. So that was put into consideration for the diagnosis and the high thyroperoxidase levels. Number 6 is fourth line of testing for Hashimoto's encephalopathy is electroencephalograph EEG. EEG shows the slowing of background activity in slow waves in the brain. Often show waves are mostly in the delta range and can be continuous, intermittent, diffuse, or focal. Then there's the line of treatment for Hashimoto's encephalopathy. Number 7, first line of treatment is corticosteroids, up to 32 months of treatment until the anti-TPO, TSH, FT3, FT4, anti-TG, and TRAB levels are back to normal and there is complete or near complete return to the patient's neurological baseline status following corticosteroid treatment. The corticosteroids utilized in HE, Hashimoto's encephalopathy treatments, are methylprednisone intravenous and prednisone oral. There are also biological medications such as rituximab, myoclophenate, azathioprine, or methotrexate. Those names are all hard to pronounce, so I did my best. These medications are utilized if a steroid-resistant state develops or corticosteroid-sparing immunomodulators are needed. So corticosteroids may need to be administered during the period of several years if the patient is resistant to initial treatments, or corticosteroids are administered on an intermittent basis depending if there are cases of HE relapse. I've had bad reactions to corticosteroids. My face had swollen up. I had headaches, rebound headaches from it. I had nasal spray that had the corticosteroids in it. It made me really sick. So I can't use corticosteroids for the treatment of migraines or Hashimoto's encephalopathy. That's why I did the IVIG and the SCIG. If patients have hypothyroidism, then levothyroxine is added to their treatment. If patients have seizures, then anti-epileptic drugs are added to their treatment. So my form of levothyroxine for treatment of the hypothyroidism is desiccated thyroid, which is a natural medication made out of pig porcine glands to treat the hypothyroidism. I can't use synthetics like Synthroid. It just makes me very sick. Gives me gastrointestinal problems, stomach pain, makes me vomit, makes me very hungry, and also creates hallucinations for me and headaches. So I can't use it. So I went on the desiccated thyroid. And it did help quite a bit, still helping me. So number 8 is second line of treatment is intravenous immunoglobulin therapy, IVIG, ranging from 3 to 11 months of treatment until the anti-TPO, TSH, FT3, FT4, and anti-TG and TRAB levels are back to normal, and there is complete or near complete return to the patient's neurological baseline status following IVIG treatment. IVIG is considered to be a form of long-term treatment. SCIG, subcutaneous immunoglobulin therapy, with self-injections, infusions for slower infusion rates with at-home treatments. Basically, the SCIG helps to lessen the side effects of intravenous IVIG. These side effects can include headaches, migraines, lower back, joint or muscle pain in the legs, fever, rash, hives, chills, etc. So for me, the IVIG did work great. It instantly improved my vision. The double blurry vision started to go away, and it stopped the coughing episodes. But unfortunately, I did have some of the side effects of headaches, migraines, lower back, joint or muscle pain, and I also had a lot of vomiting. So that's why I had to go from the IVIG to switch to the SCIG, home infusions, injections for myself on a weekly basis. In some cases, a lifetime treatment of IVIG or SCIG may be required for treating Hashimoto's encephalopathy if the disease had not been diagnosed early on in its beginning stages of development, or recurrent treatment of IVIG or SCIG may be required, as HE, Hashimoto's encephalopathy, could go into periods of remission then relapse in between treatments. So for myself, I will be treated with the SCIG for the rest of my life to keep the 50% improvement that I've gotten with my health. If I stop doing it, I'll revert back to having the previous symptoms of the double blurry vision, the coughing issues, allergies. So I'll probably revert back to those symptoms if I stop taking it. So I'll be continuing to have it renewed every year by the neurologist. So number 9 is third line of treatment is plasmapheresis. Plasmapheresis is a method of removing blood plasma from the body by withdrawing the blood, separating it into plasma and cells, and transfusing the cells back into the bloodstream of the patient. It is performed especially to remove antibodies in treating autoimmune conditions. Number 10 is the detection of the anti-NAE antibodies for the anti-NH2 terminal of alpha enolase NAE for markers of Hashimoto's encephalopathy for diagnosis. So basically it goes on to describe the whole process. I'm not going to read it off. It's pretty medical sounding jargon, but it would be good to have the anti-NH2 terminal of alpha enolase tested, that particular set of antibody. But again, it's not available in North America, not in Canada or the United States, and it's only available currently in Japan. So you would have to travel to Japan to get this tested. It is tested in Tokyo, so that's the only place where you can get it done. And the sources of information for this diagnostic criteria, testing, and treatment methodology comes again from the Hashimoto's Encephalopathy, a Rare Proteoform Disorder article. And it's pretty thorough, I would say. It's the best criteria that I could find in protocols for how to diagnose and treat Hashimoto's encephalopathy. So I found it very thorough and very useful for myself, and I followed the criteria down to the letter completely. And it does seem to work pretty well, in my opinion. I had also reviewed the limbic encephalitis associated with the anti-NH2 terminal of NLase antibodies, a clinical subtype of Hashimoto encephalopathy article, and I included that in the criteria and protocols section, along with the other article from Japan about Hashimoto's encephalopathy, like how the whole process is done to test the NH2 alpha NLase antibodies. I did not read off how it's done because it's a long medical explanation, but it's very interesting. It was for me. And then I was asked to provide an explanation of why you are submitting this technology for consideration. I did submit this to a technology review panel in British Columbia, but it's a complicated process of review. I thought I would show this example here of what I actually submitted just so people could see it. And I'll explain why I submitted it. I am submitting the diagnostic criteria, testing criteria, and treatments technologies for Hashimoto's encephalopathy because currently the medical system in British Columbia, Canada has zero diagnostics protocols, testing protocols, and no specific treatment protocols for HE, Hashimoto's encephalopathy. We do not have any research programs or medical trials programs where patients can participate in working with medical researchers to develop diagnostics, testing, and treatments for the purpose of putting Hashimoto's encephalopathy into remission, or at least finding appropriate treatment protocols that can slow down the progress of this rare autoimmune disorder. As well, there seems to not be any medical doctors or other professionals who have the training to diagnose, test, and treat Hashimoto's encephalopathy HE patients. So the patients are sent to various medical practitioners who cannot figure out what is wrong or going on with the patients that have unexplainable symptoms of disorder disease. These patients are left to suffer with physical pain, mental trauma, and no accurate diagnosis for what is specifically wrong with their medical health. In these circumstances, patients might end up being left with the wrong diagnosis or no diagnosis at all, spending the medical system's resources on unnecessary and expensive medical testing, still leaving them, the patients, with more questions than answers about their health conditions. In the meantime, the patient's physical health and mental health further deteriorates, leaving them open to possibly becoming disabled, either temporarily or on a permanent basis, because of their rapidly declining health and inability to function on a daily basis due to poor health conditions. This can include not being able to get out of bed, walk or talk, not having the ability to leave your home or drive, as well as not being able to enter public transportation due to debilitating pain. Patients can end up visiting various medical clinics, hospitals, and other medical facilities and being continuously referred back and forth between these medical facilities because no one can find out or figure out what is wrong with their medical conditions unless deeper medical testing is done to diagnose rare autoimmune disorders. This means going beyond the surface level of medical testing and doing specific medical tests based on the patient's symptomology, not just making assumptions that if the patient has several weird symptoms, then it is just a mental disorder of some sort, like conversion disorder or functional neurologic disorder, where it's considered to be mental health issues or some type of physiological health issue, but it can't be diagnosed. So it's kind of like the bin for saying we don't know what it is. It's conversion disorder. It's everything and nothing at all for diagnosis. That's what I was describing here. The medical system needs to start doing more thorough medical testing and taking medical history accounts that addresses finding the root cause or causes of medical disorders, diseases, which is especially needed for the appropriate diagnosis and treatment of rare autoimmune disorders/diseases. There are currently no medical laboratory clinics or medical programs in British Columbia or anywhere else in Canada or even in the United States where the anti-NH2 terminal of alpha enolase NAE test can be done to determine the markers and diagnosis of Hashimoto's encephalopathy. The Canadian citizens fairly pay their taxes and MSP billing, so why does Canada not have the allocation of medical resources to develop means of doing the NAE testing for patients with rare autoimmune diseases like Hashimoto's encephalopathy, HE, for example? Hashimoto's encephalopathy is a serious medical condition with many health repercussions that can often have patients with complicated neurological deficits and impact cognitive abilities where patients can no longer walk properly, talk, or even function on a normal daily basis, ending up permanently being on disability because their health rapidly deteriorates without proper medical diagnosis and treatment, which is currently not easily available to Hashimoto's encephalopathy HE patients in British Columbia, Canada. So the emphasis that I was trying to communicate here is that rapid deterioration can happen of patients with symptoms who have Hashimoto's encephalopathy. So one day you can be feeling great and tomorrow you could collapse and can't walk anymore. And you're all confused and you're disabled. That's what I'm using as an analogy of an example of rapid deterioration for such patients. Hashimoto's encephalopathy is a rare autoimmune disorder that is connected with the systems of the neuroendocrine system, neuropsychiatric, and neurological factors. This disorder disease has severe medical consequences if not treated in time. Patients end up with dementia, coma, being put in nursing homes because they cannot take care of themselves, or in some cases being put on long-term disability and no longer being able to work at all and holding a stable and permanent job. That happened to me. I'm still not able to hold a full-time or even part-time job because I still have some neurological issues that happen from time to time, and I need specialized environmental accommodations in my own house in order to function properly. So even I am not perfect, despite good treatment. The various symptoms of Hashimoto's encephalopathy range as follows: confusion, disorientation, psychosis, hallucinations, coma, tremors, convulsions, cognitive difficulties, concentration problems, attention span problems, difficulty retaining information, short-term memory problems, seizure activity, myoclonus or myoclonic jerks, rapid, involuntary, uncontrollable muscle jerks or spasms. That's the chief problem that I still have. That's not easy to control with medication. Myoclonus. Dementia, fatigue, sleep disorders, hypersomnolence or insomnia, altered consciousness, coordination difficulties, headaches, migraines. That's also stuff that I had for headaches, migraines. Other symptoms can can include episodes of stroke, episodes of stroke-like deterioration, right-sided hemispheresis, right-sided partial paralysis, left-sided hemispheresis, left-side partial paralysis, aphasia, which is speech difficulties, articulation difficulties, word-finding difficulties, fine motor movement problems like coordination of arms, hands, fingers, because all these symptoms can overlap with other diseases and disorders. It is oftentimes difficult to diagnose Hashimoto's encephalopathy, so a process of exclusion of diseases or disorders must be done. That's very important. And then I was asked, is this a new or pre-existing already in the health system technology? And I answered no. The diagnostic criteria, testing criteria, and treatments for Hashimoto's encephalopathy is not a new or pre-existing already in BC's health system technology. In fact, there are no such technologies currently in Canada, as far as I know of, as well as there's nothing in the United States. So in my opinion, the forensics of medical methodology and research requires proof for scientific experimentation results, and also to have medical test results. You need proof to diagnose something and to treat something if it's serious health issues that are hidden or hidden disabilities. Following criteria for diagnosis and treatment, then doing testing should therefore provide a positive outcome for disease or disorder improvements. The test results should reflect the success of managing the medical condition or conditions. It's a must. There needs to be a diagnosis and a treatment plan in place based on the medical test results. And my neurologist had to dig deep with MRI tests, brain SPECT, TSH levels, TPO levels testing, spinal tap to exclude other forms of encephalopathies. I had a psychiatric evaluation. I had neurological evaluations. I had different types of evaluations to try to figure out what the heck was wrong with me or what medical conditions I had. So there's a lot of things involved in diagnosis and treatments of rare autoimmune disorders. So the very first MRI that I had done in 2015 showed that I didn't have any white matter lesions. And then I had an MRI done on February the 10th, 2017. And that's when it was discovered that I started having the white matter lesions. And the image shows a medium-sized white matter lesion deep in my brain. And my hypothesis was that it was just that migraines weren't just cutting it, that it was more than migraines, more than hemiplegic migraines and migraines with and without aura. The TPO levels, antithyroid peroxidase levels, were pretty high, almost close to 4,000 in the antibodies levels. And that was an indication of suspected Hashimoto's encephalopathy. I put that on my own MRI, my own hypothesis. I did the arrows, the circle, and the write-up. And I put it all together in a diagram for myself because I had gone to a psychiatric evaluation and I simply just didn't think that it was just anxiety and conversion disorder. I couldn't come to terms with that. Yes, I do agree that I have anxiety and I have symptoms of that, and that showed up on the brain SPECT for the increased cerebral perfusion. Yes, anxiety I do have, but I don't agree that I have conversion disorder per se. I think the migraines and the Hashimoto's encephalopathy are involved in this, not conversion disorder. So I showed this to the shrink, to the psychiatrist who I went to see, and he said it's impossible. You don't have encephalopathy of any sort. I don't know what this is. I'm not an expert in this. So you have conversion disorder. Okay, fine, whatever. That was the psychiatrist's diagnosis of conversion disorder. Okay, whatever. I still needed to be treated for migraines, and I still needed to lower the high TPOs. So I went to my neurologist, and I did ask the neurologist, can we try experimental treatments of IVIG and SCIG just to see if there's some improvement in my symptoms? The neurologist said, sure, why not? All the other meds have not worked. Why? There's no reason why we shouldn't try this and see if it helps you or not. So we decided on 1 year's trial for the IVIG and SCIG. I did 3 months of the IVIG, then I did a year of the SCIG, and it showed improvement in lowering the TPOs and in all my other symptoms. So now I get the SCIG reapproved every year. So going back to this MRI, this very first MRI where these white matter lesions appeared. So my experiment was this: medical evidence of Hashimoto's encephalopathy diagnosis for SCIG subcutaneous immunoglobulin IgG treatment. I knew I needed the treatment. So based on this MRI, I said to myself, try the biological medications. You remember doing this on Mars? Try it here. It can't possibly hurt you. It'll probably make you better because it's a biological medication, and it did help me. So the technique that was used on this MRI was a multi-sequence, multi-planar MI images of the head that were obtained at 1.5 T zoom on a Tesla MRI scanner. Images of the head were obtained prior to and following administration of intravenous contrast material. So I did have contrast done for this one MRI. And the impressions and the findings from the MRI were as follows. A solitary new focal area of abnormal increased signal intensity is demonstrated on T2 weighted sequences within deep cerebral white matter in the left mid-centrum cerebellar oval, image 20, series 5, image 27, series 9. That's where the white matter lesion showed up on the MRI, and the measurements were 9 by 5 by 5 millimeters, meters, sorry, not millimeters, it was in meters. This finding was not present on the previous MRI examination from August 2015. The lesion does not enhance, so the contrast could not enhance the lesion, so I wouldn't need contrast in the follow-up MRIs. No abnormal enhancement of brain is demonstrated. The new solitary white matter lesion is nonspecific. The differential diagnosis is broad and includes atypical migraine and demyelination. So I thought, okay, why don't I compare this MRI results with MRI results for Hashimoto's encephalopathy? From the Hashimoto's encephalopathy, a rare protiform disorder, article the criteria. So I went to the neuroimaging section on page 471, and what I found in the info was quite interesting. And that goes as follows. Brain MRI may be normal at the time of diagnosis in up to 50% of adults and 39% of pediatric patients, or in the remaining cases, demonstrate a large spectrum of abnormalities. focal or confluent white matter lesions. So Hashimoto's encephalopathy can cause headaches and migraines and white matter lesions. Migraines can cause white matter lesions. The migraines I have on their own, and I also have Hashimoto's encephalopathy on its own. And as a combination that's put together, it's not pretty. It's not fun. The symptoms are debilitating. So it needed to be treated. So it was treated with IVIG, and it's still being treated with the SCIG to this day. Doing this exercise of mapping out the MRI imagery, doing the exercise of the proposal for the diagnosis, testing, and treatment criteria technology was also worth it. By doing all that research, by going through my self-hypnosis notes back to the biological medications and how human plasma can be used to treat rare autoimmune disorders, migraines, and reverse neurological brain damage, and also clean up the antibodies. By doing all of that, I have been able to improve my health 50%. To me, that's big. 50% improvement in health is big. I wasn't able to achieve doing that with anything else that I had done or taken medications like Sibelium, Topamax, clonazepam, Cipralex, Melts. None of those medications did anything for me, as well as the Diamox. So the IVIG and SCIG were my clear options at the time, and still to this day, they are my clear options for SCIG for treatment, continual treatment constantly. So by doing all of this, it was able to help myself. And, I'm thankful that I'm not in some psychiatric ward. I'm not in the loony bin. And, my anxiety has also been relieved, and the depression symptoms have been relieved while being on the SCIG. Those are other benefits of it. So for me, that's pretty good. So in addition to doing the diagnostic criteria for diagnosis, treatment, and testing for Hashimoto's encephalopathy, I also did a workup type evaluation of myself as a medical patient, and I titled it Hashimoto's Encephalopathy Diagnosis Evidence Based on MRI and Blood Work Results. Correlation for receiving the SCIG treatment. So I took all my medical test results and lined it up with the diagnostic criteria itself to build up the evidence base for why I needed the SCIG treatment and to justify it. So I took the MRI examination report from February 10th, 2017, where the clinical history query was check for hemiplegic migraine, as well as seizure disorder, Posado seizures, or non-epileptic seizures. And based on that finding, it was what came up in the MRI. It was a solitary new focal area of increased signal intensity, as demonstrated on the T2 weighted sequences within deep central cerebral white matter in the mid-left centrum cevola, image 20, series 5, image 27, series 9, and it measured as 9 times 5 times 5 meters. And it said that the basic finding was not present on the previous MRI examination from August 2015. Those basic findings that were done in August 2015 for that MRI showed nothing. There hadn't been any white matter lesions in 2015. The lesions showed up in 2017 in the more advanced MRI with the contrast. So the impression again was that there's a solitary new focal area of abnormal increased signal intensity. It was demonstrated on the T2 weighted sequences within deep cerebral white matter in the left mid-centrum ceveola. Again, image 20, series 5, image 27, series 9, and it measured 9 by 5 by 5 meters. And the findings show that that white matter lesion had not been present there during the August 2015 MRI examination. And the impression is basically that the lesion does not enhance with the contrast, so I would not need contrast again if I was to get follow-up MRIs to monitor the lesion or lesions. So, and it said that the new solitary white matter lesion is non-specific, and that the differential diagnosis is broad and includes atypical migraine and demyelination factors. So it could be some type of white matter disease. It could be caused by migraine. So there wasn't a definitive answer of what was causing the white matter lesion at the time. So, and I made a note for myself that both of the other MRIs from March and November 2017 still showed the white matter lesion in the brain with hardly any change in size. So I needed some kind of a treatment to lessen the lesion loads because there wasn't any change happening. So something had to be done. So I started to gather information for creating the diagnostic criteria on how to diagnose and treat Hashimoto's encephalopathy. So I went and read that Hashimoto's encephalopathy, a rare protoform disorder article. And it said in the article that brain MRI may be normal at the time of diagnosis in up to 50% of adults and 39% of pediatric patients, or the remaining cases demonstrate a large spectrum of abnormalities, focal or confluent white matter lesions. So I needed to create an evidence-based formulation for myself to chart my MRI findings, my various blood work, to determine what was going on and what treatment would work best for myself. So I did the blood work charting of the results, correlating with Hashimoto's encephalopathy criteria. And I took everything, all my blood work that was done from September 6, 2013. My TSH had been 10.87 at that time, so it was hypothyroidism equals Hashimoto's thyroiditis. My thyroperoxidase AB levels were 534, equaling Hashimoto's encephalopathy, so both the TSH and the thyroperoxidase levels were high. So then I also charted the blood work done in January 24th, 2015. TSH had been 6.0. Hypothyroidism still equals Hashimoto's thyroiditis, still high. But I had been starting to take the desiccated thyroid medication, so it lowered the peroxidase levels, and also kind of like it lowers it, then goes higher, lower, lower. The peroxidase levels didn't make much of a change at all for that. But it did lower the TSH, so that was good. Still, it was high at 6.0, but better than nothing. Then I tracked the blood work done on July 22nd, 2017. Thyroperoxidase levels did go down to 382. That's still high, but much better than 543. So there is some change and a chance for improvement with doing the desiccated thyroid medication. Still equaled hypothyroidism and Hashimoto's encephalopathy, but lowering those thyroperoxidase levels is very critical when somebody has Hashimoto's encephalopathy, because again, even a small change and a chance to improve blood work levels is better than nothing. And then the blood work that was done on October 5th, 2017, unfortunately, the thyroperoxidase levels jumped to 3,894, which totally equaled Hashimoto's encephalopathy. And I made a note of why that happened. I had moved to Kelowna, BC in August of 2017 until October 2017. While in Kelowna, I was exposed to radon gas, which was 15 to 99.9%, and also uranium radiation, 6.0 to 7.9%. So being exposed to radon gas and radiation basically exacerbates my autoimmune disorders, and it created the Hashimoto's encephalopathy flare-up episodes. So the symptoms of the radon gas exposure was me having a hard time breathing. I had throat and chest pain. I was choking, and I was having a constant cough and coughing. I also had a minor respiratory infection, and I went to the hospital about 5 times in Kelowna. I also had minor episodes of migraines, some psychosis, a lot of myoclonic jerks, especially at night, and 2 months of insomnia. And those are all classical symptoms of Hashimoto's encephalopathy, as well as migraines. So I knew that something was wrong with the environment in Kelowna. At the time in 2017, I had no idea it was the radon and the uranium radiation. It's just geographically there in Kelowna in the mountains, in Black Mountains, where I was living. That's what the complex was called, New Housing Development, Black Mountain. They were also doing a lot of rock blasting there because they're building new house complexes there. So the radon gas can't be seen, it can't be smelled, it's invisible, it's in the ground. I'm highly sensitive to it because of my autoimmune disorders of hypothyroidism and Hashimoto's encephalopathy. So it did affect me in a bad way. And I had severe side effects of the myoclonus and the insomnia. Those were the 2 baddest side effects of being exposed to invisible radon gas. So I dropped everything. Me and my family moved back to South Surrey, and I'm never going back to Kelowna again. And that was a wise decision because I had blood work done on October 26th, 2017, and my thyroperoxidase levels dropped to 384, still equals Hashimoto's encephalopathy Then December 22nd, 2017, I had blood work done again for the thyroid peroxidase levels, and it jumped to 386. So it kept jumping higher, lower, again equaling Hashimoto's encephalopathy. So I was still having flare-ups, unfortunately. I was coughing a lot, still had the chest and throat tightness and pain. So I was having allergic reactions and obviously having myoclonic jerks from time to time. Nothing as bad as in Kelowna, and my sleep was slightly improving. But again, it was not being controlled with any medication for the flare-ups and the episodes. So the thyroid peroxidase levels were jumping up and down. That's not good. So I obviously needed some kind of a medical treatment. So I decided to do the biological medications. I decided to go with IVIG and then afterwards SCIG to get the Hashimoto's encephalopathy under control and to lessen the flare-ups. And the blood work will show that the thyroid peroxidase levels after about 6 months did start going down. So there had been blood work done on May the 26th, 2018, and at that time the thyroid peroxidase levels had dropped to 373, still equaled Hashimoto's encephalopathy, but compared to 386, it was starting to lower, so that was a good sign. And by that time in 2018 of March, I had done the IVIG immunoglobulin treatments for 3 days, and it worked. And I made notes of what the results were after receiving the intravenous immunoglobulin IgG therapy. So my vision was no longer blurry, and I didn't have double vision anymore. I could see much more clearly, especially for long distance. The constant coughing had stopped, and I was no longer having the choking sensation in my throat. I was having less allergic reactions to scents and smells and fragrances because I have multiple chemical sensitivities, and those were reduced. And I was having less memory lapses and cognitive issues. I could think more clearly and remember things. My ferritin levels, iron levels, had also been returned to normal, and they were no longer so low. I wasn't feeling so fatigued. One of the benefits of IVIG is that it sometimes can restore low ferritin levels to normal. So that was a benefit for me. The IVIG treatments were done on March 19th, 20th, and 21st of 2018 at 105 mg per day for the consecutive 3 days in a row. And I instantly started to see improvement in the symptoms. So it was worth doing. So I sent in a letter to Surrey Memorial Hospital. At first I was denied, and then I was approved to start the subcutaneous immunoglobulin IgG SCIG therapy starting July 2018, again at 105 mg. I had side effects from the IVIG. I had some migraines, lower back and leg joint pain, and myoclonic jerks for 4 days. That's why I had to switch to the SCIG treatment. I was doing slower self-infusions of the SCIG, and it helped to lessen the side effects of the IG infusions. As I was doing smaller dosing as opposed to the larger IVIG dosing. But in the long run, it's better for me to receive smaller dosages of the SCIG weekly than larger dosages of IVIG monthly. I don't have migraines or muscle or joint pain. I don't have myoclonic jerks, and I'm not vomiting when I'm doing the SCIG as well. I don't drive because of the migraines, so I only have to pick up the SCIG every 3 months at a blood bank clinic in the hospital, as opposed to going to the outpatient clinic for 3 to 5 days every month to receive the IVIG. So for me, it was side effects and also transportation issues to do the IVIG. So home self-infusions with SCIG for me is much better because no side effects, and I can't take public transportation or drive because of the migraines. So that's another aspect of why I'm doing the home infusions for the SCIG. Then I also compared the blood work improvement after initial trial of doing the IVIG for the 3-day infusion. Original blood work without treatment had been in December 27th, 2017. Thyroperoxidase levels had been 386, and blood work with treatment on May 26, 2018 had improved. Thyroperoxidase levels were lowered to 373. Again, with IVIG and SCIG, it does take time to lower the thyroperoxidase levels, but it can be done, and it was done for me. I also tracked the original blood work without treatment for the T3 free levels. On October 26, 2017, the T3 was 6.47. November 23rd, 2017, it had been 6.93. December 20th, 2017, T3 was 6.60. December 27th, 2017, T3 had been 6.72. February 28th, 2018, T3 had been 7.91. And basically, when I had done the IVIG in March and then done the blood work in May 25th, 2018, the T3 was lowered to 5.23. So it did even out, and it was not high anymore. It was good. So I also did the tracking for the ferritin levels without the IVIG treatment. February 28, 2018, ferritin levels had been 83. And then with the IVIG treatment, when I did the blood work on April 4th, 2018, the ferritin levels were 213. So 83 is low for me. I do feel some muscle and joint weakness in my legs and arms when my ferritin levels, iron levels are low, and I can physically feel it. So the benefit of the IVIG is that it returned my ferritin levels to baseline normal. I feel good when it's 100 or 200 something. So that's very important to have the blood work track improvements of IVIG. So I needed to have the TSH measured, the T3, and the ferritin levels while I was doing IVIG treatment to see how the levels were evening out and improving, and they did. So the blood work baseline tells its own story for the improvement. And I made a note that the thyroid peroxidase TPO levels can be lowered with also having a good food diet, making adjustments when switching to an organic diet without GMOs, low sodium, gluten-free food, no alcohol, chocolate, or caffeine, as well as no processed foods and no processed sugars or drinks. As well as environmental factors can play a role in thyroid peroxidase TPO counts. If something in an environment like toxic gases, chemicals, etc. are triggering the Hashimoto's encephalopathy episodes, this can cause the thyroid peroxidase TPO levels to get higher, increasing various symptoms of both neurological, neuropsychiatric, and neuroendocrine factors of Hashimoto's encephalopathy health condition issues. So it could create relapse episodes and flare-ups. So basically, treatments with corticosteroids, IVIG, SCIG, plasmapheresis, and other biological medications can help to reduce the thyroid peroxidase TPO serum counts and improve the symptoms of Hashimoto's encephalopathy episodes, or even create remission so there's no flare-ups while receiving treatment, or even when no longer doing treatment. For some people it goes into permanent remission, and some people need to do the IVIG, SCIG on and off to see improvement. So the sources of information for this stuff came from Hashimoto's encephalopathy, a rare proteoform disorder. I did take my own notes, and I also outlined some of the criteria factors in order to do the health comparison of what was going on with me, to do the medical charting correctly. And I went and looked at the diagnostic findings on page 470 of the article. It says that generally patients present with neurological or psychiatric symptoms which lead to the subsequent discovery of thyroid dysfunction, or they have a history of thyroid disease with sudden onset of neurological symptoms. However, cases where neurological symptoms preceded the thyroid disease have been reported. So I've always had issues with anxiety and a bit of depression. When I was diagnosed with hypothyroidism and Hashimoto's thyroiditis. And in Kelowna, the anxiety really got bad. So it had gotten pretty bad. So it kind of factored into the diagnosis of Hashimoto's encephalopathy, because I was having neurological deficits and the basically neuropsychiatric issues. And then I also looked at the laboratory findings, which were on page 470, and it says laboratory features include elevated concentration of ATA in the blood, mainly the thyroid peroxidase TPO levels, found in 86 to 100% of cases. So having seen that in my own blood work results was kind of the deciding factor of why I was diagnosed with Hashimoto's encephalopathy by the neurologist. That's basically what that was about. And I mean, that's what the findings are in the criteria. And, you know, my neurologist has very good understanding of what migraines are in Hashimoto's encephalopathy and what the treatment needed to be. So I was put on the IVIG and then SCIG for those things. I also looked at the diagnostic criteria, medical evidence, test results, and also symptoms of Hashimoto's encephalopathy. on page 471 of the Japanese diagnostic criteria. So I started off with the diagnostic findings and occurrence percentages. For myself, it was the anti-thyroid antibodies. I had the elevated anti-TPO antibodies. Thyroid peroxidase levels were high, and for patients that's 86 to 100%. That helps with diagnosis of Hashimoto's encephalopathy. There's also the thyroid hormones, euthyroid or subclinical hypothyroidism, 65 to 75%. And I go up and down between being euthyroid or having subclinical hypothyroidism. I have to constantly manage that to make sure I don't have subclinical hypothyroidism. Euthyroid is when your levels are normal. Or having clinical hypothyroidism, that's 16 to 20%. I also had that. I had abnormal MRI results, typically non-specific changes. My white matter lesions were non-specific category, and that could be 36 to 49% in patients. The brain SPECT results showed increased cerebral perfusion, and that's normally not so typical of Hashimoto's encephalopathy, but it's kind of borderline, so you can't use it as a diagnosis factor. So my brain SPECT couldn't be used for a definitive diagnosis. It was the MRI test results and the high thyroid peroxidase levels in the blood work that were the deciding factors for a diagnosis. So again, my thyroid peroxidase levels, antibodies were high, and sometimes my TSH levels would be high as well, and that sort of counts towards diagnosis as well, although they mainly look at the TPO levels for diagnosis. And I also looked at, again, on page 471 for basically the deciding factors of what meets the diagnostic criteria for Hashimoto's encephalopathy to diagnose it, the medical condition itself. So, number one is encephalopathy manifested by cognitive impairment, which I had, and one or more of the following: neuropsychiatric features, hallucinations, delusions, or paranoia. Didn't have any of that. I had myoclonus, quite prominent. There's also generalized tonic, clonic, or partial seizures. My seizures were classified as non-epileptic or having focal neurologic deficits. Number two is presence of serum TPO levels, so high thyroid peroxidase levels, which I do have. That's why this stuff is outlined in yellow of what I had. Number three is being euthyroid status or mild hypothyroidism. For example, TSH being high, that would not account for encephalopathy. My TSH was issues with thyroid levels. And again, I needed the desiccated thyroid medication to balance that out. And the high thyroid peroxidase levels were a deciding factor for encephalopathy, not the TSH per se. As well as number four, no evidence in blood, urine, or CSF spinal tap analysis of an infection, toxic, metabolic, or neoplastic process. I had none of that. I had migraines and Hashimoto's encephalopathy. The spinal tap was clean. It showed nothing. It was negative for everything. So that met that criteria. Number 5 is no serologic evidence of neuronal voltage-gated calcium channel, voltage-gated potassium channel, or other currently recognized paraneoplastic and autoantibodies to indicate another diagnosis. For me, none of that had been checked, so I don't know what the results of that would have been. That wasn't checked. Number 6 was no findings on neuroimaging studies indicating vascular, neoplastic, or other structural lesions to explain the encephalopathy. My lesions were found to be caused primarily by migraines and suspected Hashimoto's encephalopathy. So not the other types of encephalopathy, specifically Hashimoto's. Number 7 was complete or near complete return to the patient's neurological baseline status following corticosteroid treatment. Since I'm allergic to corticosteroid treatment, that's not a defining factor in meeting the criteria results because I did the IVIG and SCIG. So I can't meet that criteria, although I did return about 50% of health improvement to the baseline status for improvement in neurological baseline evidence. So I do count as meeting the criteria just for myself because I did have health improvement for that. I also looked at correlating symptom evidence of Hashimoto's encephalopathy on page 407. And I fall between the line of relapsing and remitting course for Hashimoto's encephalopathy, and that's 50 to 95%. Seizures, focal generalized, 52 to 66%. I have non-epileptic seizures, so I fall somewhere in the middle on that. Myoclonus, 37 to 65%. I'm mid-range for that. Psychosis, 25% to 36%. I would say I had very mild psychosis symptoms. It was nothing crazy, just slight, bordering on maybe a bit of psychosis. I did have cognitive dysfunction, and that's between 36 and 100%. Again, that's midline. The psychosis is usually 25 to 36%. I think mine was below 25%. Sleep disorders, hypersomnolence or insomnia, that's usually 55%. For me, I would say it was about 80% insomnia. So higher than what is usual for Hashimoto's encephalopathy. Headache is 13 to 50%. I would say it was about 60% for me. There's also fatigue, which is 2%. For me, it was about 70% fatigue. I was always tired. There's other symptoms, but I'm not going to list all of those off because I only listed the ones that I was experiencing and the percentages for them. I did not experience any of these other symptoms. That's why I'm not reading them off this chart. So I also double checked other various symptoms of Hashimoto's encephalopathy, and that adds sort of a little bit more to the checklist range. This is without the percentages. I had confusion, disorientation, mild psychosis. I had cognitive difficulties, concentration problems, difficulty retaining information, short-term memory problems, some type of seizure activity, non-epileptic. I had the myoclonus, rapid involuntary, as well as uncontrollable muscle jerks and spasms. I had bad case of fatigue, bad case of sleep disorder. I had the insomnia. I had some coordination difficulties. I had the headaches, migraines. I predominantly had the left-sided hemispheresis, which was partial paralysis or full-on paralysis, mainly because of the migraines and partially because of the Hashimoto's encephalopathy. I had some articulation difficulties, I had word finding difficulties, and I also had the fine motor movement problems, coordination of arms, hands, and fingers, especially during the paralysis episodes. I also made a note that on December 10th, 2014, I had a total laparoscopic hysterectomy with the uterus and cervix being removed in order to stop the side effects of constantly having hemorrhagia and pernicious anemia. I had been always fatigued and had menstrual period cycles that lasted for close to 2.5 weeks and severe abdominal cramps and back pain. So I needed a total laparoscopic hysterectomy to correct all of those issues. My lowest blood count for the pernicious anemia had been on December 22nd, 2011. The ferritin levels were 5. That's extremely low. It's pernicious anemia, and that's not good. So I got the hysterectomy to correct that issue, among one of those issues. So during December 2015, I had felt ill with increased hemiplegic migraines and paralysis. I felt that there were some complicated neurological symptoms, and like I maybe had Epstein-Barr virus at some point. So I was tested for that, and the results came back that the Epstein-Barr virus capsid IgG was reactive. The Epstein-Barr virus capsid IgB4 was non-reactive, and the final Epstein-Barr virus serology report said evidence of past EBV infection, but not of acute infection. So at some point in my life, I did have Epstein-Barr virus. It impacted the IgG levels. So basically, my Ig levels did show reactive, and the IgM showed non-reactive. So I had between a mild form and somewhat higher form of Epstein-Barr virus, but not so infectious that I was going to suffer from it long term. So I read that sometimes Hashimoto's encephalopathy triggers can be as follows. And it's on page 468 of that article. So risk factors for Hashimoto's encephalopathy are not known, but single cases have been associated with the following items. Trigger events such as menses, menstrual cycle, and Epstein-Barr virus, EBV, infection have also been reported. So those are triggers for Hashimoto's encephalopathy. Concomitant autoimmune disorders such as pernicious anemia have been documented to trigger Hashimoto's encephalopathy flare-ups and episodes. I had pernicious anemia, so that was one of the triggering factors. And then I also went on to explore the treatment options for Hashimoto's encephalopathy, and that was on page 471 and 472, and that could be with corticosteroids, that can be with other biological drugs, serums, medications. And for each person, the outcomes are different in terms of statistics for treatment. And there's also the intravenous immunoglobulin therapy, and the subcutaneous immunoglobulin therapy. I'm not going to list off all of the treatment plans and what it's all called because honestly, it's a lot of information. So it treats for epilepsy, it treats for seizures, it treats for migraines, it treats for hypothyroidism issues, for all of that, any of those medications. So there's a lot of symptoms in Hashimoto's encephalopathy and a lot of different treatment routes that people can take. Many people go with the corticosteroids and the prednisone, which is also steroids, for the initial treatment. And if that doesn't work, they try out some of the other biological drug serums. And if that doesn't work, it goes to the IVIG and SCIG treatment phase if it's not responsive to any other type of medication, basically. So I was mainly interested in the second line of treatments in resistant cases or relapses where intravenous immunoglobulin IgG was being used, or SCIG. And it says that for the IgG treatment, it can be successful, and the dose would need to be 2G for 5 days, and one or more courses of treatment may be needed. For me, it was 3 days of the IVIG at 105G per day, coming to 500G something throughout the 3-day treatments. And then I also had to do a bit of research to find out about the SCIG as the alternative treatment for me, because I did have some of the side effects of the IVIG, which I discussed earlier. So then I was switched to the SCIG. I also looked at the disease markers information on page 472 of the diagnostic criteria, and it says that some authors maintain that there is a relationship between antibody levels and the disease course of Hashimoto's encephalopathy, claiming they would decrease with improvement of symptoms and increase at time of relapse. That's mainly the thyroperoxidase antibody levels, and that's true. Sometimes it goes up or down based on the relapse or remission of the HE, Hashimoto's encephalopathy. So, during the course of the disease, it can improve and it can go up again. So it can be higher or lower, depending where you are, whether you're in remission or relapse stages or you're having flare-ups. So the thyroperoxidase levels can go up or down. But it can be a bit of an indication for what is going on with your symptoms. So for me is being monitored as well for blood work once in a while to see where I'm at. And then I also decided to show the copies of my MRI results. So the MRI where the lesion showed up was on February 10th, 2017. And again, it said that there is a solitary new focal area of increased signal intensity, which is demonstrated on the T2 weighted sequences images within deep cerebral white matter in the mid-left centrum cereoli, image 20, series 5, image 27, series 9. This measures 9 by 5 by 5 meters. This finding was not present on the previous MRI examination from August 2015. I want to be as honest and transparent as possible, so I am sharing the actual medical test results from how everything was diagnosed for the migraines and the Hashimoto's encephalopathy, the blood work, the MRIs, the brain SPECT. All of that is being shown here. And in February 10th, 2017, I had a mid-sized white matter lesion in my brain. That's what I started off with. So the February 10th, 2017 MRI shows that there's the new solitary white matter lesion. It's non-specific, and the differential diagnosis is broad and includes atypical migraine and demyelination factor. And I had 7 consecutive MRIs done from 2017 to 2019. I'm only going to be showing the last MRI that was done on September the 17th, 2019. And it's basically showing the improvement of, me not having a big lesion load anymore. Yeah, so that's the MRI from September 17th, 2019, and it did a baseline comparison to the December 2018 MRI, and the results are as follows. The previously noted left centrum alveoli lesion is now almost imperceptible. Vague increased T2 signal for the right pons as seen on the most recent prior exam is no longer discrete. No new focal brain abnormality. The ventricles and basal cisterns remain patent. No significant extra-axial mass or abnormal fluid collection. Impression. The left centrum alveoli shunt is now almost imperceptible. No definite abnormality in the right pons as seen on the prior study. So that's my last MRI that was done from September 17th, 2019. The white matter lesion is hardly imperceptible. There's no more lesions growing in my brain. So I was told by the neurologist that there's not going to be a follow-up MRI anytime soon, as the IVIG and SCIG treatments seem to be working to decrease the white matter lesion loads in my brain. And it's showing on the MRI results. So I don't need to do these MRIs every 6 to 12 months anymore because there's a lesser lesion load in the brain. It's almost gone from the MRI results. So this is the results of my brain SPECT that had been done on November 14th, 2018. And this was done to make sure that I didn't have severe hypoperfusion from the various forms of migraines that I have, which is hemiplegic migraine and then migraine with and without aura symptoms. And on the day when the brain SPECT was done, I didn't have any type of migraine at all. So basically they couldn't really test for the hypoperfusion. What was noted on the test results is that there is increased cerebral perfusion. And it was noted for the basal ganglia and thalami in my brain, which can be seen in emotional disorders or depression. So basically what increased cerebral perfusion means to the deep structures of the brain has been described in patients with depression and affective disorders, which can be an anxiety, depression, conversion disorder, functional neurological disorder, or other unexplained medical conditions that have severe neurological deficits. So this brain SPECT could not be counted to provide a diagnosis for Hashimoto's encephalopathy, although in some criteria, increased cerebral perfusion is counted as towards suspecting Hashimoto's encephalopathy as a potential diagnosis, but not not in any criteria that would be accepted in North America. So this brain SPECT test results, it just proved what the psychiatrist diagnosed me with, which was generalized anxiety, basically, and conversion disorder. But my migraines basically is the primary issue in the Hashimoto's encephalopathy, not the conversion disorder. Because I don't panic. I don't just get anxiety over nothing. So conversion disorder is mostly psychological factors. My medical issues are mostly physiological. So conversion disorder is kind of like an alternative diagnosis when nothing else can be diagnosed. And I had been diagnosed with Hashimoto's encephalopathy and hemiplegic migraines and other forms of migraines way before I had seen the psychiatrist. So every doctor has their own diagnosis, medical one, and every doctor has different views and opinions about treatment plans and options. So I would seriously do all the blood work, do the MRIs, brain SPECT, whatever is needed to diagnose whatever medical condition somebody has, and to double check the diagnosis as factors. Because doctors can diagnose patients with many different things which you may or may not have. I like to see the medical proof, the medical test results, viability of medications, whether they're creating improvements in people's health or not. So for me, I'm very scientific and logical, and I tend to believe the medical test results more so than just verbal diagnoses that go into reports. So it has to be backed up with evidence, medical evidence. If it's not there, it's just not there. And I have a harder time believing a diagnosis of any sort if the medical test results don't back it up. In my case, the MRIs and the brain SPECT, the MRIs back up that I have migraines because I have lesions. The brain SPECT backs up that I have anxiety. Therefore, those two diagnoses I do believe, and I've had improvement with the IVIG and SCIG in terms of Hashimoto's encephalopathy symptoms decreasing. So I've had some remission and less relapses. So yeah, I do tend to believe what the doctor diagnosed as Hashimoto's encephalopathy and that I'm receiving correct treatments for it. So, I need medical evidence. Without it, I'm a skeptic. So I follow the 3D criterion for diagnosing and testing and treatment plans especially for Hashimoto's encephalopathy. I do like the Japanese article quite a bit. It's very thorough, it's honest, it's complex, and I like it. And it's good criterion. And that's what I've been following with these diagnoses. And honestly, without that criterion, I wouldn't have had the successful treatment that I have. Without the hypnosis regressions, I wouldn't even have the knowledge regained back that you could use biological drug serums to basically reset and reboot your autoimmune system and to boost it. I wouldn't have known that. I wouldn't have known that you can use immunoglobulin therapy to lessen the loads of white matter lesions or to reverse white matter lesions completely. If I hadn't done all that hypnosis stuff, I wouldn't have had a clue really about all that medical knowledge that just sits in my brain. That's there for the picking if somebody wants it, and I guess I was desperate enough to want it and to gain it back, so I did with the hypnosis and the past life regressions as well. So for me, it did work. It helped me. I had actionable, viable medical data that can actually be used on myself in medical treatments to reverse some of the medical issues that I've had throughout the last 5 to 7 years in my life. So this is the blood test results measuring my thyroperoxidase levels starting from October 6th, 2017, when I had a relapse of Hashimoto's encephalopathy severe episodes. And at that time, my thyroperoxidase TPO levels were very high at 3,894 in Ileana. Then going back to January 22nd, 2019, my thyroperoxidase levels were at 277, considerably lower than the almost 4,000 range, where I was having the severe myoclonus and insomnia. Again, I had taken steps to be on the IVIG, the SCIG. I moved back to South Surrey, British Columbia, to live near the beach of all places, which is better for my health than the mountains in Kelowna. There's no radon gas and there's no uranium radiation near the beach in South Surrey, White Rock area, where I am now, back home basically. So I changed living conditions, environment completely. I went on the biological drugs, serums, medications that are available here on Earth, which is the immunoglobulin, which comes in intravenous form and subcutaneous form. I do the subcutaneous self-infusions of pure, clean human plasma every week, and I pick it up every 3 months at the blood bank at the local hospital here, and I have to do it for the rest of my life. And I gained all this medical knowledge back by doing the self-hypnosis and the past life regressions, and just basically tapping into whatever I had done in the Black Ops Secret Space Program service. In my time on Mars working in the Cybernetics Labs. That medical info comes from there. I had to correlate it with the medical information that's available here on Earth to find the immunoglobulin treatments, to find the appropriate dosages, what worked for me, what didn't. Had to be on it for a year and a half for it to actually work, to reverse the white matter lesions and to reverse the symptoms of Hashimoto's encephalopathy, so I'm not constantly relapsing and having flare-ups. So that was a lot of work, a lot of medical knowledge that had to be retrieved from the hypnosis sessions. I had to do the diagnostics, correlation, criteria, protocols. So I had to map everything out, all that medical info. Had to map up the blood work, the MRI test results, the brain SPECT, and again the blood work test results as well, to measure all of it to see if the immunoglobulin therapy in its various forms, that it was actually working for me, so that I wasn't injecting myself needlessly every week. It is working, it's successful, and I'm going to keep at it because obviously it works for me. Health improvement of 50%, I'll take it. I'm thankful for it. On the right side, we have the subcutaneous immunoglobulin therapy, 2 years of treatment, and what this involves is having a syringe that administers the immunoglobulin plasma itself. It's connected to infusion tubing and to the infusion needle set and to the pump that automatically pumps the immunoglobulin therapy into the subcutaneous layers of my skin on the stomach where I do the weekly infusion. So that's what is involved with the SCIG. On the left-hand side, we have the intravenous immunoglobulin therapy. I did 3 days of treatment, and that involves having an IV with saline at first to flush out anything in the body. Then it's connected to the immunoglobulin IgG therapy itself, to the immunoglobulin plasma. That's connected to the IV tubing and goes intravenously into the body through the arms of the patient. And that's basically outpatient clinic, done at the outpatient clinic every month, 3 to 5 days consecutively within the month, as opposed to the subcutaneous immunoglobulin therapy, where that's done in the home infusions every week for myself. I do it for myself by myself, as opposed to having it done at a hospital or outpatient clinic where nurses have to do the procedure for you and you have to be there for hours. Both treatments worked for me. Both treatments had positive outcomes for me, and I needed both to stabilize my health and to see improvement in my medical conditions. So I needed both. I had both done, and now I am on the subcutaneous immunoglobulin therapy permanently. Have to have it renewed every year by the neurologist and get it approved, which I do because I need this life-saving biological immunoglobulin medication to keep improving my autoimmune system and to make sure I don't relapse with Hashimoto's encephalopathy flare-ups or episodes, as well as to keep reducing the white matter lesion loads in my brain. And it's a measure of seeing the test results and seeing the lesion shrink in my brain, seeing the blood work with the thyroperoxidase levels lowering. So there is physical medical proof that the biological drug serums have done their job on me. The measures had been taken, everything had been trialed for these medications, for these biological meds. They work on me, and I'll be on the SCIG probably for the rest of my life to keep the health improvements that I've made so far. This is an example of what my intravenous immunoglobulin therapy log file looked like for the 3 days that I got the GammaGuard immunoglobulin intravenous therapy done at the outpatient clinic for 5 to 6 hours per day for 3 days, starting on March the 19th through March 21st. So the nurses had to put in the date, the time, and the serial number of the IVIG that they were using on me, which was GammaGuard to infuse me with intravenously. And then what I had to do on my part was log in the improvements that I was having and also any side effects that I was having of the medication as a result of using the biological medication. So on my first day, what I wrote in my log file was on the other comments: my long distance vision is bad after IVIG started. Seeing things clearly and did not need glasses to focus on long distance objects. Stopped coughing from allergies. So that's the first 2 improvements that I noticed on the first day of doing IVIG. And the log file was pretty much the same for the 3 days. except on the third day I did have side effects of migraines, vomiting, and joint and muscle pain with myoclonus. So I wrote down the side effects of that on the third day log. I'm only showing one example of the first day so people can see what it looks like. The nurses also write the diagnosis and indication for why the transfusion is needed. So they put Hashimoto's encephalopathy for me. That's what the neurologist diagnosed as the medical condition. So that's what was on the log sheet for the intravenous immunoglobulin treatment and transfusion. And I had to mail all of that out to Surrey, to the local hospital in Surrey, where I live. That was done, and then after, I also had to write a letter why I need the SCAG instead of the IVAG, and had it looked at by the director of the hospital. Then I needed the neurologist's approval and assessment of the same outpatient clinic to switch me to the SCIG. So all of that was done, and it took a bit of time, but I'm very grateful that I am on the SCIG and that I got to do the 3 days of the IVAG, because it's really improving my health still to this day. This is an example of the log file and records that I have to keep for the subcutaneous immunoglobulin therapy that I do weekly, on a weekly basis. And I have to put in the date, the length of time that I do the self-home infusion, the placement on my stomach, left and right, where the needle sets go in, and it's small 27 gauge needles. And I do 30 ml of the SCIG on a weekly basis, and it's called QV-True. That's the brand of the SCIG, and I have to have all of that on the log file for the home infusion program that I'm under from the outpatient clinic. And the SCIG has to be reordered every 3 months for me for supplies and for the biological medication itself. So I have to pick it up at my local hospital, and I have to save and keep these log files, and I send them to my SCIG nurse every 3 months. So that is how that works, and I only included one page as a sample so everybody could see what this looks like and that I'm genuinely doing this every week. It's honest record keeping. I do it. I have better health thanks to it, and I'm going to keep on doing it because I don't want to regress backwards in my symptoms. I want to see more improvement in my health, and I'm dedicated to doing the SCIG likely for the rest of my life to keep up the current baseline of 50% health improvement that I've gained, and like I said, hopefully get that baseline raised in a higher percentage of improvement throughout the years. I had done a bit of a diagram for the benefits of intravenous immunoglobulin therapy, IVIG, and subcutaneous immunoglobulin therapy, SCIG. What the treatment does for me and why it works. So I described the therapeutic roles of IVIG and SCIG. Both of them provides protection against infection and creates the ability for the suppression of inflammatory/autoimmune processes all over the body. For the IVIG infusions, I had done 105 G in March 2018 with 3 days of it, with significant improvement in memory, vision, and myoclonic jerk stopping. Basically, that was the first therapy that I got, and then I got the SCIG. And the dosing infusion schedule that I have is on week 1, I do 30 ml on Wednesday, and week 2, I do 30 ml on Monday and 30 ml on Friday. Each week I do rotation. For week 1, receive 30 ml once in the week, and for week 2, receive 30 ml twice in the week, so that I get a larger dosage on a weekly basis. IVIG, you get like 500 G throughout the 3 days. For me, I need smaller needles to do the infusion sets for myself with the SCIG because I'm not a big girl. I don't have a lot of fat on myself. So based on my weight and height, the SCIG dosage has to be considerably less than the IVIG was. But I get it consecutively every week, and I have a very specific dosing schedule that works for me. And it's been developed over the last year and a half of what I can do and how much I can do of it. So it's very specific to me. So the SCIG self-infusion benefits is that the SCIG allows for self-infusion at home without needing to be in a clinic or a hospital on a monthly basis, and there's no side effects from these infusions. And the mechanisms of immunoglobulin therapy are as follows. It reduces inflammation, it boosts the immune system, and also it blocks allergens from increasing the glucocorticosteroid binding affinity in the body. So that's very interesting. It also, both IVIG and SCIG, it binds the T cell processes and cytokines and creates a infusion of fresh autoantibodies, IgG or IgM or other antibodies. It introduces that into the bloodstream of the patients, and it cleans out the damaged and dirty antibodies that are within the body itself to mitigate the autoimmune damage that has been created with the disease disorder of Hashimoto's encephalopathy. And you get constant infusions of the immunoglobulin, and it basically cleans out your body and prevents inflammation in the body. So it keeps you healthier as a result. So the benefits of IVIG and SCIG for me for treating the hemiplegic migraines and Hashimoto's encephalopathy have been as follows. IVIG and SCIG boost the autoimmune system to lessen fatigue and provides more energy. IVIG and SCIG blocks the allergic reaction processes, so there's no more coughing, wheezing, throat tightness, and reduction in reactions to scents and smells, as well as I don't have chest pain anymore. IVIG and SCIG creates reduction in myoclonic jerks and joint pain or muscle pain. IVIG and SCIG lowers the thyroperoxidase AB levels, as was shown in the blood work test results in this presentation. IVIG and SCIG reduces inflammation in the body. So as a result, there's no more inflammation for me from gluten foods, allowing a broader food choice. I can't eat gluten forever on end. That's out of the question, but I can try a bit of gluten food sometimes. I don't have a horrible reaction of always having a migraine with paralysis now with the SCIG. So that's helped quite a bit with the paralysis issues from the migraines and the aura symptoms of the blurry double vision. So IVIG and SCIG have been great for restabilizing my autoimmune system and also for decreasing some of the migraine symptoms. So there's been suppression of inflammatory processes in the migraines. So as a result, there's been a reduction of the white matter lesions in my brain because of being on IVIG and SCIG treatments. IVIG and SCIG reduces memory lapses and promotes clear thinking for me. IVIG and SCIG reduces and stops the double blurry vision caused by migraine auras. The IVIG and SCIG provides some reduction in the light sensitivity that I've had over the last 7 years. I'm very sensitive to fluorescent and LED lighting. I would constantly get a migraine with paralysis, so the hemiplegic migraine, and I would have horrible blurry double vision auras, migraine auras, under those types of lighting. I can't sit under fluorescent or LED lighting. What I have at home is incandescent and halogen light bulbs that are frosted, and it's always under some kind of shade in the ceiling lamps, so there's no bare bulbs anywhere in the house. It's no fluorescent lighting at all, and no LED lighting, only incandescent and halogen 40-watt bulbs or 60 watts in some places. So even though the SCIG and IVIG have helped to reduce some of the light sensitivity, I still have it. So I can't be under fluorescent or LED lighting for more than 15 minutes per day. So basically it allows me some ability to go to the store with somebody accompanying me. I can't drive myself, so somebody always drives me, and they accompany me for any type of short duration shopping that I need to go sometimes. But the SCIG has allowed me to go outside more for walks, just for short duration walks, 30 minutes a day. The sun doesn't bother me anymore. The glare from the sun doesn't bother me because I don't wear any type of glasses. It gives me usually the tightness of the glasses. Even the lighter frames usually will give me a migraine. So I don't wear any type of glasses at all, not even for long distance vision. So the SCIG has given me a lot back in terms of sunlight reduction sensitivity with my vision. Yeah, so I can go outside on a sunny day and not feel like I'm blind as a bat because I can't see anything because of these migraine auras. So that has been a great relief for me, and I'm so glad that this medical experiment worked and that I was able to access all this medical knowledge and information that I've had in my head all along from working in those Cybernetics Labs on Mars way back when, and that Quantum Leap time travel program and the 16 back secret space program or Black Ops programs, whatever you choose to call it. That medical knowledge from working in those labs, that's still in my head. It was in my head all along, and I regained it through the self-hypnosis to help myself improve my complicated medical conditions. As the doctor said, my neurologists, my family doctor don't know about the self-hypnosis or about any of that other stuff, that I had prior knowledge about the drug serums and the biological medications. They have no knowledge of that, and they never will. This presentation has been made specifically to explain why hypnosis in general, or self-hypnosis, can often provide information for us who have memories of previous lifetimes as ETs, or have memories of having been secret space program assets in these various Black Ops programs that are secret. Sometimes we have actionable data, whether it's medical, whether it's advanced technologies, whatever it is, oftentimes we do have the actionable data to improve something in our lives with this information of what we did in these programs. For me, it happened to be medical information of how to improve my health. So I just went with that and I did the medical experiment. It was successful for me. So I'm glad I had kept my hypnosis notes over the last 4.5 years that I had done it on myself, and that those hypnosis notes were actually useful and true in the medical data that was there for me to use on myself with the immunoglobulin treatments and all the medical tests that I needed to have done on me to prove the efficacy and viability of continually doing the immunoglobulin therapy treatments to continue to improve my health. So it's successful, it's been done. This experiment is ongoing for the rest of my life. I'll be on the SCIG and I'll continually receive immunoglobulin, new human plasma in me that somebody else donates. So I'm glad that this stuff is here for us. Well, for me, the immunoglobulin therapy. For somebody else, it could be other medications, biological medications that would work for whatever autoimmune disorders that they have or other medical conditions where it's applicable to use biological drug serums.